Good afternoon, everyone. We'll hold on for some few minutes for more people to join. I just want to let you know that we are online, and thank you very much for keeping time. We'll give people like 5 minutes, then we start. Thank you very much. Okay, we are going to start. You are all very welcome to this afternoon's Interns Induction workshop. Thank you so much for coming. Would like to recognize every intern that is here. We are so proud of you as you've joined the honorable, noble profession. You are at the start of your journey, and we are really happy to have you. I would also like to thank all our speakers. Thank you so much for coming. I'll give you some introduction, and then I'll request Dr. Mwebesa to give the opening remarks. Can you see my screen?
Yes, we do.
Okay, thank you very much. So all of you now interns are at the beginning of the life cycle of a health worker. Before you've been in the education sector, most of you probably entered as the high school graduates. A few entered at diploma level. And all that time when you've been in medical school or School of Health Sciences or the health professions education institutions, you've been working towards becoming a health professional. And right now you are at the level just transitioning from the education sector into the health labor market. And this is where you get employed. And that transition between that orange and green is really internship. You're just at the beginning of that very important life cycle. And it is a journey that some of us have taken over the years, and you'll hear from many people that have gone through this journey. We are still going ahead to impact the lives of others as health professionals. And you people who are just beginning your journey are very, very important in this profession. So we are really happy that you could take this time to join and be part of this induction. And all this is aimed at improving the health of others, but that others also includes ourselves. So we'll hear from some people who will tell us about how to take care of ourselves, especially emotionally, psychologically, but also physically. And as health workers, we are expected to be available, to be accessible, to be acceptable, and to be of high caliber, to show that we are high quality health workers. And all this with the aim of improving health outcomes. So you've started internship. You know that it is a transition phase between being students to being recognized independent practitioners. This is where you acquire the required practical skills, not only in clinical work, but also things like communication, administrative matters, and communication skills are really important, and leadership skills as well. And this precedes registration into a fully fledged member of the health profession. It is a busy and challenging experience. It can be stressful. It can sometimes lead to burnout, mental health problems, and a poor patient outcome. But we do not want that to happen. And that's why we put up this, this induction program, so that we can talk to you about some of these things, and we make sure that you don't fall into some of the problems that can occur during the internship. And that's why we invite people that have been through it to talk to you. And who is talking to you? I'm Elsie Chiguli-Malwadde. I'm the Director of Health Workforce Education and Development at ACHEST. I was an intern many years ago, so I've gone through it, and I know what it takes to be an intern. And I really appreciate that you people are offering a great service at this point in your life. And I know that although it's challenging, you can succeed at the end of it all and continue with your journey. And that's why between the African Center for Global Health and Social Transformation and the Health Professions Education Partnership Initiative and Ministry of Health, we got together for us to put up this program for you, and we give you some insights on how to move forward. So why this induction? We know that in Uganda, graduate health workers are leaders of teams. You are leaders of teams at all levels of the health system as well as society. As soon as you qualify as a doctor, as a midwife, as a nurse, as a pharmacist, as a dentist, you are a leader in your own right. And so you are expected to behave differently. And most times you'll be a leader of a team. So these are some of the things we want to share about, to equip you to be role models in whatever you do, not only to health workers, but to society. And so you need to be prepared to be that leader in your society. Because we know as we go through the health professions education system, they really focus on making us technically competent so that we can be good health professionals. But very little is focused on management, public relations, and leadership and communication skills. So there's a need to bridge that gap. And during internship, those are some of the skills that are passed on to you, and this will be elaborated further as the other people talk. So we need to, during internship, to build self-confidence, get that professional identity, maintain a life balance, have networks, have the appropriate emotional responses, manage our expectations, but also the expectations of others, and facilitate teamwork. And still, this will be elaborated further as we go on to hear from other speakers. So ACHEST with HEPI and Ministry of Health came up with an interns handbook, and you can find it at that website. We will put it in the chat box later. And this book has components of what is going to be talked about today, but also other things that we may not talk about today. And it will be very helpful as you go on throughout your internship. You can refer to it, it's online, so please make use of it. We used to have these programs face-to-face, as you can see, but during COVID, we stopped, and we found that if we had them virtual, then we can reach more people. So now we are holding them virtually so that we meet more people. So by the end of this workshop this afternoon, we hope that you hear more about the Uganda health system, be able to articulate the Ministry of Health vision and mission. This is really important because we are under Ministry of Health, all of us as health professionals, as health workers. And it's very important for us to be in line with what Ministry of Health does, because it represents the government, and that's where we really are working most of the time. Even if you are in the private sector, really, we are under Ministry of Health, so that is important. We'll also talk about the basics of government procedures and rules, quality assurance, things that are very important in the healthcare system. And we hope that you are prepared to work in the Uganda health system and also understand a bit of the referral system, understand the job market, career progression. If you want to go into postgraduate training, how do you go about it? And it is very important that we understand how to take good care of ourselves. So in a nutshell, that's what we are going to do this afternoon. At the end of the program, we would like you to respond to the evaluation. We are going to give you an online website where you can respond. And we hope that when you respond to this evaluation, you will get some airtime refund. So please do respond to the evaluation so that we can make the workshop better. So I'll end here, and I'm going to check. I'm hoping that Dr. Henry Mwebesa is here. Yes, he's here with us, and it's my privilege this afternoon to invite Dr. Henry Mwebesa, who is the Director General at Ministry of Health, and who actually leads us in all the work that we do, and who is very passionate about making sure that interns get into the profession well prepared. So thank you very much, Dr. Mwebesa. I know you have a meeting after, but you've really sacrificed to make sure you are part of this meeting. I welcome you to give your welcome remarks. Over to you, Dr. Mwebesa.
Thank you very much, Dr. Kiguli. So, Elisa, unfortunately, I'm using my phone, and my phone sometimes is like a call box. It gets calls every now and then, but my secretary is working on my laptop. So I hope it will be fine soon when I get off the phone. So, colleagues from Ministry of Health, I don't know who has joined us from Ministry of Health yet, but I expect the Director Clinical Services, the Commissioner Clinical Curative Services. I also expected the Assistant Commissioner Budget and Finance on some of the areas I'll be highlighting. The ED ACHEST and all the management and staff of ACHEST and HEPI, hospital directors and supervisors, if there are any who have been invited to follow on this discussion. Colleagues, the interns, the medical doctors, the dental surgeons, the pharmacists, graduate nurses and graduate midwives, ladies and gentlemen. Good afternoon. First of all, I want to thank ACHEST and HEPI for organizing this Interns National Orientation Meeting, which is taking place now. As Elsie said, we've had these meetings before, but they were disrupted a bit by COVID, and we are now having it virtually. And I want to assume that in your respective training or attachment facilities, hospitals, there was some mini induction or orientation by the hospital directors and management of the hospitals and by your supervisors. I want to congratulate all of you first, the interns, for successfully completing your professional training in 2022. And I'm sorry that you started your internship training late in August, where we expected you to start in April 2023. You actually started in August 2023. That is 4 months late. But you all know the story and what we all went through. And the reasons for this delay, which were beyond our control. I'm aware of the anxiety you went through, the stress you went through as we waited for some guidance to enable us post you and allow you to start. I'm looking at my list of participants on this forum, on this Zoom meeting. There are around 90 people. So if we look at the interns that we expected, 1,900 or thereabout, and we have 90. So Elsa, do we have the audience we want? Do we have the quorum? Are we talking to ourselves or are we talking to our stakeholders that we wanted? So what is the answer there, and what is the way forward?
Thank you, Dr. Mwivesa. I think the invitation went out to all of them. Some said they will be working, so we go ahead at least and talk to those that have spared time to be here, and we hope that the others will look at the handbook.
Okay.
Thank you.
So we can go ahead and talk to, if we have 90, maybe the actual interns might be 80. Because some of them are us, some of the 90. But let's continue and see how it goes. As I was saying, many of you know the reasons that delayed the starting, but I want to believe that we have settled down now and we have started our internship training. So my point here is to urge all of us to settle down, work very hard, and complete our internship training, which now runs from August to July next year, so that we can be able to complete and be registered with our professional councils, so that we are open. Now we are out and free and open to the job market. Because without registration, all of you will not be eligible for practicing, because you will not be given the practicing certificates, and you will not be eligible for the job market. I know the nurses and midwives can do some work, but as graduate nurses, I think you need to be complete internship and be registered with your professional councils. Just a little update is that we have now 61 training sites, up from 48 training sites last year. This was mainly to cater for the increased numbers, to accommodate more people, and to make sure that they are distributed without crowding the training sites that we have. So from 48, we increased to 61. And this is because of the number of the interns that we have. If you look at the progress of the interns, in 2021, we had about 1,471. 2022, we had about 1,600 and something, about 1,608. 2023, the current group, we have now the numbers that we posted were 1,921. Of course, those include the foreigners and also include the refugees and the Ugandans, of course. Next year, we expect something around 2020. That's the expected number. Many of you have been knowing that we had 1,901 interns to be posted, but now we have 1,921. And this was posting of all those who graduated in 2022. I got some questions. How did we change this number? How did it come to 1921? And how did we post a few people who graduated in 2023? I want to clarify it to some of you today. In the 1,901, which we were expected to post this year, who were graduates of 2022, included in there were slots of about 137, around there, of King Caesar University, who were included in that group and we are adding up to 1,901. And we had included them on our list in terms of numbers. But until the date of deployment, these King Caesar University graduates, I think MBCHB, were they dental surgery? I don't remember. But anyway, the graduates, the medical graduates from King Caesar had not yet been cleared by the medical council. And I think up to today, they have not yet been cleared by the medical council. So that meant that we are going to post around 1,700 something if we excluded King Caesar. And anyway, we couldn't post King Caesar because they didn't have provisional license to practice, which is issued by the medical council. So
what they want to talk about?
I think somebody needs to mute. Somebody who is talking and is open needs to mute. So we consulted here, and at that time we had already received in the Ministry of Health provisional licenses for MBCHB and BDS of 2023 from Makerere University. Makerere University expedited their graduates and submitted to the council, their graduates, and the council had submitted to us their graduates of 2023. Hello, am I still on? Somebody was trying to call me.
Yes, you
So
are on.
So we discussed as Minister of Health and said now, since King Caesar is not coming, and we have slots of 137, and we have, I think, 148 from Makerere University. Instead of letting this opportunity go, let us deploy the graduates from Makerere University who graduated in 2023. So they really got that chance, opportunity, and they managed to sneak through because they were available with us by the deadline and there was opportunity from that group. So that's how we came up now to post the Makerere group. And I know many people who submitted their names later from other universities like KIU, like I think Mukono University also, who graduated in May this year, had also submitted, so they were also catered for. So the other universities who graduated in 2023 and submitted their cases after July 28th, because you remember we released the list on July 28th, and we are supposed to start on August 4th. So everybody else who submitted the list after that date, we didn't take them, and we advised them to come next year. This included many from the Pharmacy Council, Pharmacy Society, who submitted their lists in August. But that was a bit too late. So I thought I wanted to clarify on that because some people kept sending me WhatsApps consulting on that, but I couldn't start clarifying to each and every individual person. And now that I have got the opportunity, I thought I should use this to clarify that point, especially concerning the Makerere graduates. Good. The next point I want to talk about is that we're expecting the list from the training sites. Many of them have so far submitted. We have received, I think, about 70% or 80%. But not all training sites have submitted their list of interns that reported. I know a few have been writing to us asking for a dead year, especially nurses. I don't know why. But so far, we need to receive lists from all hospitals. And I want also, this reminds me, I want to be sure that all hospital directors have given you placement letters signed by the hospital director where you were posted in a duplicate, where you get one copy and you give a copy to the hospital director, which I think they're also supposed to give us a copy. So by the end of this week, you must receive all lists from all the 61 training sites in order for us to compute your monthly allowances. We expect the release from Ministry of Finance this month, cater for your allowances, and we should be able to pay your allowances by the end of September. And that will cover your 2 months of August and the month of September. So if we get the list by the end of this week, we should start computing your money, and we should be able to pay before the end of September all your money. How much money are we paying? Is it taxable or untaxed? I've been getting so many of WhatsApp requests to clarify on that. As far as I know, as far as was confirmed to us by Ministry of Finance, we are supposed to pay 1 million net to cater for your accommodation and meals. It's not a salary. The logistics or the details can be worked out by finance. If they want to put there the tax over and above, and then they deduct it, that is for the financial managers. I'm not a financial expert. If they want to send us 1 million net, that is for them to decide. But what I know, the take home for individuals is 1 million. For logistic purposes, finance can decide to say it will be 1 million plus taxes. Then when they deduct their taxes, we remain with 1 million net. So all I can say that what was confirmed by Ministry of Finance is the take home is 1 million. The logistics of calculation is not my headache, or should not be our headache. And I'd asked our Assistant Commissioner, Budget and Finance, but I asked him later, I don't know if he has joined in to help and clarify on that if possible. Now, as we talk about the lists, I want to say this very categorically. We are aware of a few interns who swapped stations on their own. You are posted to Mulago and you decided to swap with somebody based in Soroti. So you come to Mulago and the other one goes to Soroti. Now, unfortunately, that will not be accepted. If any training sites accepted that, then they are messing you up and they should not do that. That will not be recognized. 1, for payment of allowances. 2, for approval, the medical internship committee, and therefore for signing you off as one who has completed internship. So if the internship committee posted you to Soroti and you end up in Arua, then you know that there you are volunteering and you are not doing your internship as mandated by the internship committee. And that goes on to say that I was under strict instructions not to change anybody from a station where they were posted, even if it was a request by politicians, or any VIPs. I was under very strict instructions not to change anybody. And as a disciplined civil servant, I did not change anybody. So if anybody changed the station and you went where you are posted, as soon as we receive the lists, let's say I've got a list from Mulago, the department here responsible for curative services and human resource department will sit and cross-check the list from Mulago with the list that was signed by the DG Ministry of Health. If they find somebody submitted by the executive director of Mulago who is not on our list, then the committee will delete that person off and will not be counted as somebody doing internship this year. I know it is harsh, but this is part of the discipline that we are trying to emphasize, because that does not stop there. These are the same people, kind of people you can end up with. Tomorrow, once they have qualified and they are recruited in service, you post them in Bundubujo, they say they want to stay in Kampala. So what would I advise such a people to do? If you know you are in a training site where you are not posted, the best case scenario, which I don't know if it will work, is to ask your hospital director where you are and say, sir or madam, I'm here, say in Kirudu Hospital, but I was posted to Sorot Hospital. Can you give me a letter of recommendation saying that I have already done 6 weeks in Kirudu Hospital and indicate the work I have done in Kirudu Hospital, so that you go with that letter to the station where you are posted, say Soroti, and pray that the supervisor in Soroti will accept the recommendation of the ED Kirudu and allow you to continue your training in Soroti. The second scenario is you go to Soroti and start afresh, and you'll finish 2 months later over the period you have so far missed. Those are the two best case scenarios. The third scenario is to wait and do your training for your placement next year. Next, on the issue of discipline, we noted a lot of indiscipline during the period of waiting for placement or deployment. Quite a number of you were so provocative, but we put it behind us and kept quiet. But what we want to urge is that when you are in the medical profession, it is really a profession of disciplined people. When I call you a doctor or a dental surgeon or a pharmacist or a nurse or midwife, there is a certain level of discipline that I'm expected to behave as a doctor. I cannot behave in the same way like any other person or any other cadre. A doctor should behave in a certain way. And that's what I really want to urge you. That's what I want to urge the trainers, that let's mold our children to grow into that respectable profession of the health profession with the quality and the caliber expected of us in terms of discipline and in terms of performance. So we are doctors, we are nurses, midwives, we are pharmacists. We need to behave in a way that is expected of us. The Ministry of Health and the top management really is interested in molding professionals that will treat us tomorrow. So there is no way anybody in the Ministry of Health would do anything against our own colleagues. You are young, but now that you have graduated, you are already our colleagues. So we would want to do everything possible to make sure that life is comfortable for you and you are joining a profession which you like and which you would be proud about. So please, I want to urge you to remain disciplined and I want to urge the supervisors in the training sites to mold our children to those levels expected of the medical profession. Rotation, as you know, rotation is for 6 months in each discipline, either surgical or medical, 5 months in the major and 1 month in the minor. And I want to believe all of you have been told about that. We expect you to complete your training or your placement in your current stations, except in very few stations that we shall have a rotation, change of sites at 6 months. Maybe because the surgical, if you are, let's say, doing a surgical profession like in Kawempe Hospital, there is no medical profession there, then you may be expected to move, let's say, to Kirudu. And then the ones in Kirudu, because there are no surgical procedures in Kirudu, can move to Kawempe. So those, and there, I know there are a few, especially faith-based, church-based hospitals, which may not have specialists in one or the other. And in that case, there will be some consideration of change of station. Other than that, there will be no change of stations at 6 months. I want to urge you, 1 year is not a lot. To be patient, and we complete our 1 year, and then you are signed off and you get registered. I have 2 points to conclude. I want to urge you kindly and very seriously, please to avoid extortions and charging of patients. There is a very, very big drive to catch anybody who is charging our patients or extorting any form of money. And really, like you young people, I don't want you to be caught up in such a situation because the repercussions are very dire. I know of a case last year who was caught extorting and then was suspended, and he had to miss a whole year. We have just posted him somewhere, but wherever we would post him, they were refusing him. So I don't want you to be involved in such situations. Just be patient and finish your 1 year. And then you can go into private practice. You can go into be recruited by projects, a number of projects. You can go international organizations. You can even go outside. So be patient and complete your 1 year so that you can be registered and finish your internship properly. Next, cover of emergencies, weekends and night calls. We expect you to cover emergencies, weekends and night calls very appropriately, because usually that's where we get problems, and that's where we are always accused of negligence. Let's say you have accident cases arriving, have obstetric emergencies coming, and there is nobody there. And then we start investigating who was on duty that day. And usually out of negligence, we find so-and-so was not there. The repercussions are also very heavy, including to our own registered medical officers and the nurses, because now the community has become even more alive. They even report. This week I was reading of a medical officer who was arrested somewhere in, I think, somewhere in Mbale side there for negligence of duty. It is a very, very big problem also, which can lead to very severe sanctions, which I would not want you younger people to go through. I really pray that you don't get involved in such situations so that it affects your registration and being signed off. Finally, I thank the supervisors who are helping us to train you, especially in your practical experiences. I know many of you are very good in academics, but now this is the opportunity to turn the theoretical lessons to practical experience. So I urge all of you, the supervisors, to be very available and to train our interns. I don't want interns to be thrown on the ward alone to to now hand over the work to the interns. The supervisors must be available to supervise interns. And I'd really urge interns where the supervisors are not available, where they are throwing you on the ward alone, not also to keep quiet, but to raise a flag. I know many of you have been sending me a lot of messages. I would not mind getting a message from you saying, but you sent us to Mitiana Hospital. I've spent a week without seeing my supervisor. Such a message I really welcome so that I'm able to follow up who is working or who is training you and who is not. Likewise, the supervisors must use appropriate criteria of assessing the performance of interns before passing them out. I don't want an intern who has been failed and then comes and petitions, and then I ask a supervisor, what was the criteria for failing this intern? And somebody can't give me documented evidence. So we must have criteria for assessing the interns, their outputs, what they have done during the internship, and that helps us to say Mwewesa has passed or Mwewesa should repeat his rotation. So there must be very good documented evidence. And likewise, I urge the interns to work very hard to make sure that you pass and you are registered and you are released. Finally, thank you very much, ACHEST and HEPI for organizing this. And I thank all those who have attended this orientation. And I'll put my comments in writing for circulation to all of you. I hope somebody will be talking to you about our health system and the hospitals, the regional referral, national, general hospitals, the health center, the community interventions, the Ministry of Health strategies. I did not go through those because of the time, but just to emphasize that our main strategy is disease prevention and health promotion. We want to prevent diseases because 75% of the burden of disease is preventable diseases, both communicable and non-communicable disease. Elsie, thank you very much. And with those remarks, I want to conclude my remarks here. What am I supposed to say? Am I declaring the orientation open? Or was
Yes,
just supposed to say? Good. With those remarks, I hereby declare the orientation open for God and my country. But I'll put my comments in writing and circulate to everybody.
Thank you very much, Dr. Mwewesa, for being here. I know you have a meeting and we really appreciate those comments. And most of the questions that have come in the chats were actually answered as you presented. Maybe just one about their payments. Somebody is asking that since now they are getting their allowance in September, does it mean it will become? Yes, it will be coming every 2 months about the allowance.
I can confirm that. Sometimes we send it quarterly, sometimes so this 2 months, I can confirm that, I'm not very sure. But what we'll do, like we release a quota to the hospital, and then the hospital can pay every month. But the release from the ministry is quarterly. So like this one, they'll be releasing this quarter, the July to September quarter. But because they did August and September, so they'll be paying 2 months. So in the next quarter, we shall also release the tranche for the quarter for October, November, and December, which may be released, let's say, around November. So in that case, they'll pay October. Then at the end of November, they pay November, and at the end of December, they pay December. So I think it's supposed to come monthly. Okay. But for us, we release the money to the training site once in a quarter.
Okay, thank you very much for that clarification and all the clarifications you've made in your presentation. They are very much appreciated, and we will look forward to getting your presentation and circulating it so that even those who are not able to join will be able to know what you talked about. We appreciate your presence. Thank you very much. And since you have another meeting, we release you, and we know that the other people on the call from Ministry of Health that will continue to participate. So thank you very much.
Thank you
Dr.
very much.
Professor, and have a nice afternoon.
You can allow me now to go to the meeting, to the boardroom for my meeting,
Thank
which
you.
is being chaired by the minister, but I had asked for permission to be here.
Thank you very much. We appreciate that. So, members, you've heard from Dr. Mwebesa, the Director General of Ministry of Health, and he has really clarified on a lot of issues. So we are glad that he was able to join us. And next, we have Dr. Byanyima Rosemary, the Executive Director of Mulago Hospital. She has also sacrificed time to be here with us. We appreciate that very much. And she's going to tell us about the expected outcomes of internship. So Dr. Byanyima, over to you. And I would like to ask the administrator to share Dr. Byanima's slides. They are all there already. So over to you, Dr. Byanyima.
Thank you very much, Professor Elsie Chiguli. Colleagues, good afternoon to you. I'll talk a little bit about the expected outcomes of internship. Of course, internship is about learning and practicing. You gain experience and you get exposed to the clinical practice in real time. Next slide. Are you able to move the slides?
Yes, so it has been moved. Okay.
Okay, thank you very much. I can see that. You know, as an intern, you realize there are many stakeholders, and the few whom I've enlisted, of course, those who are at Mulago, the Mulago National Referral Hospital is a stakeholder in your internship. But those are different sites. You can fill in the different site you are in. Ministry of Health, of course, is a big stakeholder, and that's why we had that presentation from the Director General, because he's the one who signs you and sends you to us. You as interns are big stakeholders. So your parents, your guardians and friends also are stakeholders in your life, and they look forward to every positive step in your life. Next. So as Mulago National Referral Hospital, what do we expect of you as an intern? When you are sent to us, the training we take you through is practical. So we expect you to attend to your duties without favor or exceptions. You are all equal as interns. We expect you to practice maximum level professionalism and respect and conformity to moral acceptable standards. And this, of course, you should learn from your seniors. And that's why the DG said, if you have any challenges, you should also communicate to the ministry. But of course, within the institution, we have mechanisms where you report. And I think when we're doing inductions, we alluded to that. So before you report to the ministry, let's handle what we can handle within your internship center. You're not supposed to hold any other job apart from internship. Internship is quite demanding, so I would recommend that you don't hold another job. Please go back to the previous slide. I haven't finished. And if you do, it will affect your performance. Yes. Time management, if you've already noticed, you find early morning we have mortality audit meetings, or we have departmental meetings. You have to be in theater at this time, then ward rounds at this time. You have to review the emergency cases at this time. So you need to manage your time, but plan well with your supervisor. I mean, we've done internship, we know it's doable, but we emphasize time management. Be courteous. When you're handling patients, they're already distressed by their illness. The relatives are anxious. We've all managed our own relatives and friends, you're anxious, so you don't want a medical personnel who is not courteous to you. It is quite demanding, but this is part of the training we are giving you. Next slide, please. So on the respective wards where you'll be or clinics, you'll find different teams which you have to work with of different cadre. So this also teaches you to have teamwork. You'll find maybe there's a customer care person, there's a receptionist, there is a cleaner, there is a nurse, there is a doctor, there is an allied health professional. All you are supposed to be part of the team and learn how to build teams. Respect the chain of command. I do not expect, like executive director's office, to get reports which are supposed to be received at your respective departments. And that is how systems work. Try and respect them. Then you also need to respect subordinates. You know, there's a tendency, of course, when you just graduated, you still have that aura and you think one who is not holding a degree is less important. But you realize that person, when he or she doesn't do his work, then if your lab runner doesn't take your sample, then you have to run with it, and then you'll have no time to do the other work. So respect all the team players. Then just know that the patients you're working on are Mulago National Faro patients, and you've been assigned to work on them. So you are supposed to practice maximum level of confidentiality. No going home and you start talking about your patients. And even when you qualify and you do that, you'll find that patients will run away from you. Then if you're going to practice and earn a living from that, you find your earnings are dwindling. Be accountable. You know, when we talk about accountability, people think about money. But if you're a pharmacist and you have stocks of medicine, you are accountable. If you are even doing a ward round, you are given a patient monitor, that is also equipment you should account for. At the end of your duty, you're supposed to hand it over to the next person who is going to work, because you should hand it over when it is in good working condition for continuity of service. So be accountable for what has been given to you. That good stewardship is what we want, and that will help our institutions. Safeguard all institutional property in your custody. I mean, that goes to emphasize what I've just said about accountability and taking good care of the institutional property. This is property you found, you want also to leave it in good working condition for the next person who is going to work. Maybe this next group of interns who will come on board. Dress in clean, decent clothes. If you also see your colleague not dressed decently, it doesn't have to be a supervisor. Be each other's watchdogs, and encourage each other to be smart and neat, so that even your clients, the patients, the attendants will respect you for that. Next slide. So basically, that's what is we expect of you as Mulago. Now, on the contrary, of course, we don't expect you to absent yourself from duty without permission. We do not tolerate any unbecoming behavior, including those sexual gestures to staff or use of abusive language. That one definitely will take you to our disciplinary committee. Mistreatment of patients or their attendants. We cannot overemphasize money extortion. Already we are handling an incident at Mulago. You're not expected to divulge patient information to unauthorized persons. And always be careful who is seeking that information. Don't just talk to anyone who is coming to ask about a patient. until you are sure who you are diverging information to. Do not give gifts to supervisors. I do not encourage that. That will compromise your assessment, and the supervisor do not want that actually. Do not take bribes directly or through an agent. I know some people start working and they have their agents. Now even mobile money we can track, and we can ask you the purpose of that mobile money you obtain. So don't think you are being wiser by using now mobile money. Next slide, please. Now, you've already heard from the Director General, of course, who talked very exhaustively about what the Ministry of Health expects of you as interns. But just to recap a few areas, of course, they want us to impart skills, because next they'll deploy you to man centers and you should have skills. Teach you professionalism, yes, and teach you to work and do networking. You'll find that in the institution there are many other collaborators. Take keen interest on how these collaborations come on board, so that in your future you also seek to bring more collaborations, because they bring a lot of job enrichment and make the internship or even post-internship nice as you work and practice as a medical doctor. And of course, as through your internship, we teach you to make correct independent clinical decisions, which the ministry would want you to carry on after your internship training. Next slide. Next. I think the one moving the slides forgets. Now, how about you as interns? Of course, you also have your own expectations. If this was an interactive, real-time, and not on Zoom, probably would also talk about many expectations which you as interns. But previously, when I've interacted in face-to-face, some of the interns have told me, oh, I've come to so that I complete my internship, so that I finish and get my registration and go and start working and maybe make money. Yes, we want you to feel confident in your practice as a dentist, as a pharmacist, as a nurse, you know, as a doctor, as you go out. So that should be your expectation, but those are some of the examples. So please take this as an opportunity for you to ground your practical skills. And for medicine, we are always reading. So even as you do your internship, please read about the cases, do presentations, so that it's not only practical skills, because it also goes with the theoretical knowledge which you continue to acquire. Next. Then, of course, the patients. These patients you are going to work on will be the hospital clients, and they expect you to manage them well, because the hospital has entrusted them to you by allowing you to do internship in the hospital. But also the patients expect you to be courteous to them, practice high level of professionalism, and they also, you know, they are on the net, they know, they read about these things, and they also want to gauge whether you are knowledgeable. So make sure you also, you know, are smart in what you're practicing, and also to be courteous. It doesn't make you less of a professional, or, you know, it will not take away your title by being courteous. Next. I think this one would be probably the last slide. In our stakeholder analysis, we have the parents and guardians. They are cared for you through your studies, and they want to see you succeed. So They want to see you succeed in your internship so that you go to your next level in life. So you do not want to disappoint your family. The family does not want to hear that you are the one involved in funny practices at the hospital, and they want to hear that you are really a good professional, because later on in life, they will be consulting you about, I'm suffering from this, can you guide me what to do? So you also want to show them that they've invested in you, you are a good professional. But they also want you to live a responsible life. We've had where our own medical personnel have been involved in maybe drug abuse or something like that. And when you realize that one of you is going astray, please help each other, because you are more likely to identify that weakness. And if you can, please involve us so that we can redeem this person. And lastly, aim higher in your career. Internship is just the beginning, and there are many more opportunities when you finish, and would want to see you progress in career. And really, I'm here to wish you all the best in your internship and your career thereafter. And that ends my presentation. I want to thank you for listening.
Thank you very much, Dr. Byanyima. That is very much appreciated. We appreciate that you've taken this time to share with the interns the expectations, both from the side of the Ministry of Health, and also from the what the patients expect, and also what the interns themselves expect from the system. So we really appreciate that. Just one question. Somebody is asking, who is a lab runner? Maybe let me give you two. Who is a lab runner, and what is the difference between appreciation and a bribe? Please briefly respond to that before we go to the next speaker.
Thank you, Professor Chiguli. Appreciation and a bribe. You know, a bribe, someone will actually demand for it even before the service is given. But appreciation normally comes voluntarily after the service is given. But you'll find patients will actually come to office and complain, I have been requested to pay 1 million before I can be on the theater list. Is that an appreciation? Is that a bribe? Normally, it's very easy to differentiate that two. Lab runner. Some institutions also at some time, the lab may send out people to pick samples from the wards or clinics to bring them to the lab, and then later on take back the results. Where possible, we normally have such people, but where we have limited resources and we cannot employ, you'll find that you who are on the ward have to take off the samples and take the blood samples yourself. So where possible, you also sometimes can send the patient directly to the lab to obtain the samples. I think I've answered the questions. Thank you.
Yes. Thank you very much, Dr. Byanyima, for answering those questions concisely. And we appreciate your time. And we hope that we will be able to provide these presentations, but also all what has been said actually is in the handbook. So please find the handbook and refer to it. Thank you very much. So next we'll have Dr. Leonard Mutebi, who has agreed to talk to us as he just completed his internship. So he would like to give some practical experiences and also highlight some of the challenges of internship, not to scare you, but to show you that it is possible to go through internship and finish it and be successful. So in about 7 to 10 minutes, Dr. Mutebi, please share your experience. Over to you.
Thank you very much, Professor Els Chiguli. I hope I'm very audible to you all.
Yes, we can hear you well. Thank you.
Yes, dear colleagues, my name is Devi Leonard. I speak to you as a junior colleague who just completed my internship this year, and I'm currently a medical officer, already employed in private sector. I was a former president of the interns, but not under FUMI, and I'm happy that we are now so much organized, not like during our times, and I'm happy to be given this platform to share with the junior colleagues on some of the practical experiences and the challenges of internship. Thank you very much, ACHEST and HEPI for organizing such induction meetings. Like you highlighted in the beginning, these induction meetings have always been physical. I even remember vividly ours last year was very physical, but of course with the option of the Zoom meeting, and these induction meetings are very, very good. I'm just disappointed that this time around members have not turned up in huge numbers. I think they did not understand the gist of such a meeting, but yes, since you have the handbooks and all those other presentations that are going to be shared to them, because it is through these induction meetings that most of the interns prevent some of the errors that they may omit, or even some are well guided on things that they may not know. I'll be speaking to you some of the few challenges, just like professors told you, not to scare you, but just to let you know that every challenge has a solution, because we all understand that internship is a 1-year period, and it is after this internship that you are going to be well defined. It's internship that is going to define who you are going to be. The doctor you're going to be, the nurse, the midwife, and the pharmacist you're going to become in the future is going to be determined by internship. I only became a doctor after doing internship. Before you do internship, you may think you know stuff. Not until you do internship is when you realize that you didn't know things. Because I remember before I did internship, I knew how to do cesarean sections. But I'm telling you, it is after me doing internship when I understood that now I'm a doctor who can go and run a facility independently. Internship gives you this opportunity to learn as much as you can in terms of the skills and in terms of so many things, because internship is going to make you so independent and making decisions as a person. Colleagues, I want to tell you that use this internship period to make as many errors as you can, because when you err in internship, you have an option to correct those errors. But after internship, when someone employs you in their facility, you don't have a right to make any error. Right now, you can make the errors because you have the supervisors who are watching over you. But after internship, you don't have that. You don't have that luxury. You don't have that liberty of you making any error, because you're going to be an independent person. For example, when for example you are fully qualified and you enter in to do an emergency laparotomy, for example, after you're fully qualified, then you're going to make independent decisions. Of course, like Professor said, Professor Bianyima has mentioned that medicine is learning that even at higher levels you have to keep consulting, but it will not be like as you're doing it in internship. For internship, if you go, for example, to do an emergency laparotomy, for example, receive a mother who's having an ectopic pregnancy or having a ruptured uterus, at this level of internship, you cannot do a total hysterectomy. Of course, you have to inquire from the senior, and the senior must be present. But times are going to come when you can make a final decision whether to remove that lady's uterus or not. So please use this internship period to make as many errors as possible. Internship is a learning process. Learn as much as you can, friends, because this is the time for you to learn. And when you learn a lot, you're going to enjoy the medicine, you're going to enjoy this profession, because you're going to be handling the nearby future things that you are well versed with. The challenges of internship are quite many, but all challenges have solutions. And one of the challenges you have always been asking, I've seen the chats here, everyone is asking about money. That's the number one challenge. It is delay of the allowances. The allowances in internship delay. That's why you kept seeing us striking here and there. Striking is not good, ladies and gentlemen, and you should only strike if you have been pushed to the wall. For example, if money has taken like 4 months without coming, but if, for example, like Dr. Mwebes has promised you that within this month the money is coming, and once that money comes, ladies and gentlemen, handle this money, however small it is, consume it in a way that is very good. Always forecast that if you're receiving 1 million if you're receiving, for example, 2 million for these past months, how are you going to forecast more challenges that are going to come? Always think that this amount of internship is going to come later, it doesn't come on time, so that you can budget where this money you're going to receive. Otherwise, you will always have these complaints of the money, because the money from the Ministry of Health always delays. So budget well to avoid the challenges we had. For us, we couldn't budget, and that's why you saw us striking now and then, because the money usually delays for internship. But however small it is, that money can cater for the needs, because I understand most of the sites can provide for you some of those, can provide you some meals. I know most of the sites give you accommodation, because yes, I'm well versed. I know the sites that give the meals, and even those ones that give good quality meals. I even know those ones that don't give quality meals, but yes, they also provide some meals that can run you for these first months before you receive your first salary. So I want you to receive that first payment very well and budget for the future months, such that you avoid these challenges of you being there without receiving the money. But like I've told you, you are also individuals that understand, if you use your leaders and you keep communicating to the seniors and they're saying money is coming in September, but you reach December and money has not yet come, there, of course, you'll be left with an option otherwise, other than crying out loud, and the system we use for crying out loud that they can listen to. But for you to reach that point, you must have had the negotiations and dialogue with them. So that is the first challenge. Then the second challenge are these working hours. I've even seen people commenting in the groups. There are very many working hours in internship, but try as much as possible not to be broken because of internship. You are not the first person to do internship, and you're not the last person to do internship. Don't be broken because of the long working hours. Yes, they are long, but try, if you're feeling hungry, rest. If you're feeling tired, you rest. As much as I know, no one is failed in internship for resting because they are overworked. No one is failed in internship for not doing something because they were resting after overwork. The people who always failed internship and always who repeat internship have other issues with discipline, extortion, and others. But if you rest because you are overworked, doesn't mean you're going to be failed that internship. Because if you break down, if you get a complication, for example, if you get hypoglycemia and you get convulsions just because of hypoglycemia, it will not be good. Communicate that you are tired, communicate that you are hungry, and have rest. And these seniors will understand that. So that is also what? That's always a challenge. Also, we have the other challenge of having too many patients in some of these sites. Of course, we are all on different sites, we are in different groups. You will keep seeing other colleagues are free, other colleagues are fine, other colleagues are doing well. But at your site, you have very many patients. I'll give an example of a site like Kawempe. There are so many patients, and I can argue that there's a place called the bench in Kawempe where mothers, where we admit mothers from. That bench has been full ever since time memorial. So you are not the first person who's going to come and clear that bench within 5 minutes. Handle what you can as an intern in your time, but do not be broken because the patients are many, and you want to show that you're a hero who can sift the patients within 2 hours. It is not possible. Do at your pace, but of course with respect what you are supposed to do at that particular time. Then the other challenge we have in internship is the seniors who are tough. Some of these seniors are very tough, but now you are the junior. You are the least in the line. You are the lowermost in the line of professionalism. So try to handle every senior depending on their humanity and their characters. They are tough seniors. We have encountered them, but of course, it all depends on how you handle them. If a senior tries to yell at you, don't yell back. If a senior tries to say something that in a weird way, don't do it to show that you are also big-headed or Always be disciplined and be humble. That's when you're going to get as much as possible from these seniors. Even the tough seniors, a senior may be tough, but may approach you when you're a very soft-spoken person, when you're a very very humble intern, and in fact, they're going to change their mode of approach. We're going to hear examples of tough seniors, and we approach them, but for you approach them and you say very different gentlemen. So some people are labeled tough, yet in your sense, they are not tough, which only depends on how we conduct ourselves. So that's also a challenge you're going to face in internship. The other challenge you're going to face in internship is the lack of the personal protective equipment that are enough. Most of these facilities we are in, for example, the regional referral hospitals, some of them do not have enough personal protective equipment. And I want to urge you, colleagues, that in case of an epidemic, in case of any rare disease, in case of any rare symptoms, don't rush before you protect yourself. Because like I told you in the beginning, if you die, you are going to die and you are going to forget about you. Protect yourself first before you want to save that patient. We had epidemics in our time. We had an Ebola outbreak. You saw we had even colleagues who got Ebola from Mobende. They were interns, because an intern is the frontliner. You are the one at that emergency ward. You are the one who receives. So if you see signs of Ebola, if you see symptoms of Ebola, don't rush to show that for you are a hero. If you do not have personal protective equipment, don't rush to such a patient. Protect yourself first. And in case you are, for example, working at an emergency ward that does not have personal protective equipment, request for them. Some of these things are there in the stores. For example, you're at Mulago receiving patients. Patients have very many illnesses that they can spread to you. Of course, I understand the majority of you are well vaccinated for hepatitis B. It is something that we can easily acquire from these patients. Protect yourself as much as possible. For those vaccines that you do not have, receive them. If you get, for example, an injury and you have pricked yourself with a needle of a patient who is positive for HIV, confirm that the patient is already positive and rush and get PEP. Because if you become infected in the wrong run, you're not going to enjoy this profession. So these are very many challenges there, but like I told you in the beginning, every challenge has a solution. We have also a challenge of facilities that don't have accommodation, where your members are staying far from the working places. I urge you, most especially the girls, always avoid moving in the nights. Avoid moving the nights. Not only even girls. We had cases of boys who were hit at Kawempe. Some of our colleagues in internship, they were hit at Kawempe just by these hungry men all over the place wanting to just steal your bag because they think there is a laptop. So don't move in the night. And if you're moving at night, move at least in a group, move with colleagues. If you can't move with colleagues, sleep at the hospital. That is if you're staying very far from the facility. I know colleagues, for example, in Masaka Regional Referral Hospital, who are staying very far from the center. So please make sure that if you're moving at night, try as much as possible to protect yourself from such people, because you may get challenges of even sexual harassment, you may get challenges of robbery, you may get even challenges of assault. People will hit you and you get what? You get hematomas. We also have a challenge of our colleagues, the interns, who usually have comorbidities. They have known diseases to them. Colleagues who have, for example, sickle cell diseases. We have colleagues who have heart problems. I remember during our time, we lost a colleague who had the heart disease, but most of us didn't know. And this guy used to overwork. We even didn't know he had the heart disease. It was until that time when he was in certain ward and was overworking, when he got a heart attack. By the time he was rushed to the certain hospital, our colleague died on the way. So inform your seniors that for me, I'm a sickler. No one is going to blame you. Even inform your friends to know that for you, maybe you're a sickler, for you have such and such condition. They know you have asthma, so that you can always detect the symptoms and allow the members give you the necessary support. But if you just remain silent with your comorbidity, something is going to happen when you are the only person somewhere, and then you get problems. We had a colleague who used to get convulsions, and the family thought because he's overworked, not until the colleague was just diagnosed that he had epilepsy. No, so communicate that you have a disease or you have a comorbidity, so that people help you. These seniors are not bad people. For example, if you say, I'm not feeling good and you already have a comorbidity, they are going to allow you, if that is you, write very well, and then you notify them. No one is going to penalize you because you became sick. No one is going to penalize you because you got a crisis, and you'll be allowed to finish your internship very well. So those are challenges. Also, the other challenge, The other challenge, of course, even is sexual harassment at workplaces of the ladies. We didn't have it during our time, but of course, I know the year that we followed had an issue with sexual harassment. So it can also happen at workplaces where the girls can be harassed by the colleagues, the interns, or they can even be harassed by the supervisors themselves, or even senior members in the profession. So try to avoid as much as those problems. And I can tell you, colleagues, once you try and pray, you will end your internship very successful. I told you from the beginning that you are only going to be told to repeat internship because of very, very weird things that you are going to do. Number one is going to be extortion. Extortion is the number one cause of people repeating internship. I've heard even Dr. Byanyima has mentioned already, there is a case at Mulago already. You have just begun, you are just up, it is just the second month of internship and people are extorting. I know the challenge is you see your colleagues are extorting and you also want to extort because colleagues are extorting, colleagues are buying cars in three months. So they also want to buy because they have extorted out of money. Trust me, the day you're going to extort is the day they're going to get you. And I'm telling you, there's nothing as bad as extortion. Extortion is very bad. That one, it spoils your name. Two, even your colleagues themselves will not associate with you very well. Even they will not recommend you after. Whatever you are doing, read that statement they have written at ACHEST. ACHEST has written a statement that I've liked. They have said that in Uganda today, trained health professionals go to the job market, both in the public and private sector, where they face many challenges in getting timely recruitment. What we are facing right now is the timely recruitment. I know colleagues who we finished with internship who have been at home for now these 6 months without being recruited. And most of them, when you find out reasons, you won't find that colleagues cannot refer them, colleagues cannot recommend them, or even seniors cannot recommend them because they know their vices. They don't want to recommend someone who was a chief extorter. They don't want to recommend someone who didn't do internship very well. So to avoid these things and for you to be well to suit in the job market, because that's where you are heading, I want everyone who's doing internship to be focused on what is going to happen after this internship. Try as much as possible to do good, to be productive, to get very many skills, and to love your seniors, to work with your seniors, because those seniors you're seeing on those words, they're your first next employers immediate after internship. Most of our colleagues who got jobs immediate after internship were given these job opportunities by the seniors they are working with. In case a senior had an opportunity, for example, these research projects, they would first give the colleagues who are good. That's how our colleagues would get jobs immediately after internship, and others have not gotten jobs even up to now. You may see that extortion is giving you that little money, but that money is just a short time period money. That money is not long lasting, but there is a name you are fighting for and there is a name you are protecting. Do as much as possible to avoid most of those vices. And once you avoid those vices, you're going to be a very, very good intern who's going to be very well recommended. Lastly, I'm going to request you colleagues to respect everyone at your workplaces, at your internship places, just like Professor Weni Byanyima has mentioned, that even if he's a receptionist, even if he's a lab personnel, respect everyone because you do not know how. Some people may look small, some people may look small before you, but in actual sense, those people are not very small. And receive every patient without discrimination. Handle every patient, handle a patient the way you would want your relative to be handled. Don't handle a patient in a manner that you would not wish your colleague or your parent to be handled. And the other issue I wanted to also was just re-emphasizing the point Dr. Byanyima ended with when someone asked the difference between a bribe and appreciation. I'm one of the members who received a lot of appreciations from these patients, but I can also tell you, colleagues, that not all appreciation is appreciation, and don't just merely accept these appreciations. You can say patient where the blanket sign is very low. This patient has only 5,000 shillings, even they don't have transport. But this is someone who's also saying, I want to appreciate you. Look at someone, don't just accept that 5,000 or that 10,000. Someone even don't have lunch, but wants to appreciate you. But of course, there are those genuine ones, and they have it all. They can appreciate you and accept that. It is really very different from a bribe. A bribe is someone coming and put some 50,000 or 300,000 in your clinical quote, and then he keeps quiet. Then the next day says, "How did you see that thing I put for you in? Can you please try and put me on the theater list to move?" That is a bribe. But an appreciation always actually comes when you're discharging a patient. Someone has appreciated your services, someone has been in your hospital, and you have handled them very well, and they're going to appreciate you. But like I've told you, do not accept each and every appreciation, but most of the appreciation, please receive them. Ladies and gentlemen, I was given a few minutes, and I think that is what I can share with you. I wish you a successful internship period, and I know after this internship, you're going to meet. Thank you very much. Back to you, Professor Els.
Thank you very much, Leonard. That was very good. Thank you for sharing with your colleagues your experience and also urging them to really do well and succeed. So that is very much appreciated. Thank you for coming, for taking off time from your job to talk to your colleagues. Members, Dr. Naku has sent some remarks because she has a challenge and she may not be able to talk to us. So I've posted it in the chat. Please have a look at that. And next, I would like to invite Dr. Odokonyero Raymond to talk to us about stress management and how we can look after ourselves well. That is a very important topic as well. He's standing in for Professor Noeline Nakasujja. So thank you very much for agreeing to talk to us, Dr. Raymond. I know that we are really running short of time, but we are going to try to probably, instead of using 15 minutes, Dr. Odokonyero, please use 10 minutes so that we don't run over time. Thank you.
Thank you very much, Prof. Elsie, and a good afternoon to all of you doctors and nurses and pharmacists and all interns from the medical profession. I'm very happy to be here, second year running. It looks like I might permanently represent Professor Noeline Nakasujja, but I'm glad to be here. And I'd like to thank ACHEST, the Ministry of Health, for organizing this wonderful session of induction. I've started with this slide because I think I've had some of the issues that come up. I didn't intend for it to be a major slide. It was just meant to give you some sort of peephole into my life. But this slide shows you things I consider to be my passions. And now I know for sure that I'm going to talk about them at the very end. What I'm here to do is to talk about our well-being, mental well-being, and how to manage stress. What is it, this mental well-being? Out there in the community, people mistake mental well-being for feeling happy. And most people, once they're not feeling happy, then they say, I do not have mental well-being. But mental well-being is a lot more than feeling happy. It is about being able to cope with your day-to-day life. And inevitably, that life comes with stressors. It's about being able to work and to work productively. It's about being able to socialize with people that are around you, and also about achieving your potential. And that's a very contentious quality of mental well-being there. But if you think about it for a second, it actually is quite a core of what it would mean for you to be mentally well. If you're able to see 40 patients a day, and that's your potential, and you're choosing to see 5, then we could argue that perhaps you're not realizing your own potential. Maybe you can do writing. Maybe you're a great speaker, and you're not doing those, then we could say you're not living up to your potential. Hand in hand with mental well-being usually comes illness or disorder. Illness is what we experience. A disorder is what the doctor tells us we have. And mental illnesses usually are things that tend to affect how we feel, how we think, and how we behave. sometimes individually on each of these parameters alone, and on occasions, a combination of those. And usually these mental illnesses are associated with distress, or what you want to call stress. It's important for us to talk about mental well-being because it is perhaps one of the most valuable assets that we can have. I think the good doctor has been telling you about how to survive internship with your mental health or mental well-being intact. But in case you don't see the value, remember that 1 in 2 people are likely to meet some criteria for mental illness at some point in their life. That's 50% of us. We are nearly 2,000 interns. Imagine 1,000 of you will meet some criteria sometime in your life. So it's important that we pay attention to mental well-being. Now, how about stress itself? What is it? Many times people think stress is an event or a phenomenon or a situation. Those could be triggers, but stress is actually the degree to which you feel overwhelmed or unable to cope as a result of those pressures. So you are unable to manage, that the resources you have cannot solve the issues that you have. The end result is stress. So you will feel overwhelmed and you'll have all those symptoms that suggest that you're stressed out. And what is it that overwhelms us? I try to limit this to things that may overwhelm an intern. Hectic schedules for sure. Back-to-back shifts can overwhelm us. The workload itself, 9-hour surgeries and things like that can be quite overwhelming. Managing your time can be a very difficult thing. Our families, but as well, you yourself, you could become an issue. You could overwhelm yourself. And often we overwhelm ourselves by attempting to compare ourselves to others. And I think when I look through the chart, I can already see several examples where people leave their classification and try to do cross-classification. You will get overwhelmed. If you're a nurse and you want to compare your work schedule with a doctor's work schedule, you will overwhelm yourself. So try to compare yourself with yourself. Perhaps that's a better measure of growth than comparing yourself with somebody else. We cannot state enough the issue of finances. Being broke is overwhelming. Sometimes our patients' poor outcomes can overwhelm us. Community expectations on us, now that you're doctors, they know you're working. They expect you to contribute to everything in your community now. That can become overwhelming. And then, of course, there are many distractions. If you walk around Kampala, people are telling you, come and cover here in the evening, or invest your money here, or, you can get away with, living for 2 hours. Those kinds of distractions can start to overwhelm you. Understand, though, that stress is not a diagnosis. It's not a psychiatric diagnosis, but is very closely related to your mental health, because stress can lead to you having a mental health problem, but can also make an existing mental health problem worse. So it's a very, very important issue for us in the workplace. So on a continuous basis during this internship, I want you guys to be situating yourselves along this stress curve here. Evaluate yourself. What am I feeling? How am I doing? How tired am I on this continuum here, so that you know where you are and you can do something about it. Oftentimes, interns work around here, bordering on the red here. Once you start to experience anxiety and things like that, please ask for time off so that you can go and recenter. You reset yourself. continuously monitor yourself along the continuum of mental health, which is very similar. As you can see, there's hardly any difference between the stress continuum and the mental health continuum. Where am I? How am I feeling? What am I able to do? And you continue to assess yourself, almost as if you're looking for network. Because when your network is high, then you should have some of these characteristics here. You should feel energetic. You should feel positive. You should perform highly. So continuously check on yourself. How am I feeling? If you're worried all the time and anxious and irritable, that's your mind telling you to pay attention. That's your mind telling you to be able to take a break. And it is okay for an intern to take a break. And you should take those breaks. Even if it's a 15 minutes power break, take it. And be mindful of yourself. Be mindful of your time when you're eating. Tell whoever is calling you that this is my 30 minutes break. Please let me finish my meal in peace. And then seek out help. If in the continuum you're still in the green and the yellow, you can more or less take care of yourself. Do things that help you to get better. Socialize with your colleagues. Talk to somebody. If you're in the orange and the red, you may need some professional care. Most of our hospitals have counselors. Most of our seniors are counselors. They've been through these things. Talk to them about it. Tell them you're feeling overwhelmed and let them support you. What can you do in the last minute or two? There are 5 ways we can improve our mental well-being at the workplace during internship. Connect with those who are around you. And it's not just with the seniors. Most of you are going to come for internship and you'll be hero worshiping us and you're trying to kiss our feet so that we can score you highly. We are not the only people in your circles now. There are patient circles to belong to. There are people who are very useful to you and they are coming to that hospital and they're coming through your hands. So connect with the people around you. Connect with fellow interns. Connect with the MOs. Be active. Find something to do. Maybe it's exercise. Maybe it's something routine like attending a Rotary or other forms of fellowship. Be active. Don't just sit there in your free time and say, oh, I'm burnt out now, let me sleep. Be mindful. Take notice of where you are. Have this awareness of the world that is around you. Appreciate the beauty. Sometimes we are looking for the wrong things only, how overwhelming internship is, and we forget the beauty of what is around us, the beauty of the facility you're in, the beauty of the community you've gone to. Some of you have been posted to districts that you've never dreamt of going to. Don't be negative. Take it all in. Find out what the culture is. Find out what makes that district tick. Keep learning. Try something new. Adventure a little bit. And be able to have a giving heart. If you do these 5 things, then they will help you to be able to build resilience and to boost your well-being. Remember, I'm talking about a you that hasn't broken down yet. In the event that you've broken down, please get in touch with the mental health support of that hospital or pick up a phone and call Odokonyero. Last but not least, you've been cautioned heavily about not getting other jobs during internship. And I agree with my seniors on this. But that's not to say that you cannot make yourself useful during the internship. I grow trees, and this is a picture of my nursery when it was just picking up. And right now I grow close to 1,000 trees per quarter and plant them. And I grow these trees from seed. Find a passion. What do you like to do? Do you like to write poems, movies? Do it. In the evening, do it. Make sure you have a good relationship with money. I have a good relationship with money. I love money very much, but I love it philosophically. So I'm always reading about money. I'm reading about investments. You already know that your money delays to come. Why are you not reading on how to budget for money, how to save money? Because you know that rainy day is coming for sure. But it's going to be month in, month out. Every time the money delays, it's going to be a shock for you because it's like you didn't expect it. I like to say to people who always respond to school fees pressure as if it's just happening now. We've known about it. We knew the kids were coming home. So do you. You know your money is going to come every 2 to 3 months. Pick up a book, read up on money, read up on how to save, how to draw a budget. Last but not least, I love mentoring, and I have a small organization called the Monos Pride Foundation, in which we do mentorship. And I know that some interns are in this mentorship program. But I also know that some of my teachers, like Professor Chiguli, also do a lot of mentorship. This is the time. Learn as much as you can. Be a sponge. Absorb as much water as you can, because all around you is opportunity for mentorship. Leave internship when you know how to do an ultrasound on your own by visiting the radiology department. Learn how to do anesthesia, general anesthesia. These are people around you and they are dying to teach you. Learn some nursing skills. They are all willing to teach you. So seek out mentors within your community there and become a mentor yourself. And the best way to be a mentor, to be a mentee, is to find your own mentee to mentor. I would like to stop there and thank you all for allowing me to, in a very rushed way, share what I had to share. Thank you very much, and back over to you, Prof.
Thank you very much, Raymond, for sharing from your heart. And we have something to talk about. I also like plants. I love flowers. That's one of my passions. So please, I think that's really a good message. I enjoy these inductions as well because I learn from them. So please, he has offered you, there's an organization you can join. His number is there if you need some assistance. So thank you so much, Raymond. We really appreciate that presentation. And thank you for always coming when we invite you, even at short notice, when Dr. Nakasuja fails to come. I think we'll just change and keep inviting you. So thank you for being here.
Thank you,
If you have questions, please put them in the chat box. He will be able to respond to them later. So I would like now to invite Mr. Barugahare Patrick from Ministry of Health to give us a presentation on government procedures and standing orders. These are very important for us as well. So please listen carefully. I also like to tell you you don't have to share your contacts. Your contacts are already registered as you registered. So no worries about giving us your phone numbers. I would like to hand over to Mr. Barugahare now. Please make your presentation.
Yes, good afternoon or good evening, everybody. Am I online?
Good evening. Yes, we can hear you.
Yes, kindly share my presentation. It is with you. You want me to share mine?
Yeah, please go ahead and share it. As he shares, Dr. Odokonyero has shared his number and email. If you want to get in touch with him, please do.
Are we together? Are we on the same page?
Yes, please put it in a slideshow.
I think it is in.
Go down and, okay, please go ahead.
Yes, good evening, everybody. My name is Barugahare Patrick, as indicated, and greetings to organizers, participants, and the colleagues from Ministry of Health. I'm looking at Well, earlier on, somebody talked about the numbers, and I request that today's afternoon we move as indicated in Matthew 18:20, which says that when the 2 or 3 gather, the Lord will be with them. So I think I'm with everybody on board. I'm not looking at objectives. I'm going down at the definition of public service because the topic today was government procedures and standing orders. We cannot talk about government procedures when we have not looked at public service and standing orders. For this presentation, the public service basically refers to service in the civil capacity. So I'm not considering our colleagues in the uniform. It is also the service rendered in the interest of service. So if that is the public service, where is it established? In the law, you go to the Constitution of the Republic of Uganda, you will be able to understand what public service means. But also it includes those who are serving in institutions and agencies. It is not only the service under ministries, but also the service by those who are in agencies and which are called other public service. Currently, we have, for example, people working under Cancer Institute. It has recently been declared their service. Other service, those who are serving under universities. And not necessarily all of them are paid, earning pension, but they have equivalents of pension. So all those are called public servants. Then what about the standing orders, which I'm supposed to talk about today? It is just a set of rules and regulations. So long as you are going to work in the public service mentioned above. So in this case, the public service standing orders is just a single document, which we call consolidated document. And it looks generally with the management of public service and the issues concerning terms and conditions of service. Briefly, we can look at public service environment, which constitutes both the constitutional and political systems under which we operate. So the service we are under, for purposes of principles of separation of powers, is categorized in 3 pillars or under 3 pillars. One is executive, the second is called legislature, and the third is called judiciary. The public service where I and most of the people I think viewing is under executive. That is where there is the government generally. The legislature, that is where there is parliament, and judiciary, you all know it, where we have our lords and worships. Now, the public service where I or some of you want to join, how is it composed? It is sometimes called the traditional public service. Those who will be in judiciary, it is called the judicial service. And those who will go under education sector, they will be managed under education service. So for us, here in the Ministry of Health, we are under health service. Then there are those who will go to police, and there are those who will go to prisons, and there are those who are under local government. But all that is called public service. The legal framework of service is in the laws which I highlighted above, specifically the Constitution, the Local Government Act, Public Service Act, Health Service Act, Education Service Act, the Public Service Commission Act, the Judicature Act, Uganda Police Act, the Uganda Prisons Act, the Public Finance Management Act, and the Public Service Standing Orders. which is of interest tonight. Then of recently, we have added on the Anti-Corruption Act because of the pressure and the magnitude of pain it causes to the public. So when we talk about the public service standing orders, which I call the document which guides us on how we operate, this document is about public officers. Every public officer is bound by the standing orders. Now, what about the interns? Even the interns are bound by the standing orders because you will be working or doing your internship under public service, offices or hospitals. So the public officers are also obliged to read the laws I talked about for you to understand. So most of your time, you will be engaged in your clinical service. But you also have to understand some few rules and regulations that govern your stay while you relate with the stations where you have been posted. And as the saying goes, they say ignorance of any of the provisions of the standing orders or law is not an excuse to break any. So you will be treated as if you have read the standing orders, as if you have read the Constitution, as if you have read the Local Government Act, as if you have read all the rules and regulations that will be governing the station where you will be deployed. For those who would like to join the service after their internship, these are forms of the appointment that you will get. But basically, I'm interested in one, appointment on probation, because most of the people who enter the service are appointed on probation. Appointment on contract for those who will be interested in joining project work. And those who are already, for example, I'm informed that some of the interns had already joined the service under local government or in other areas as diploma holders. But now after obtaining your degree and you finish this internship and you want to join, then you can be appointed on transfer of service. There are various terms and conditions of service for those who want to join. But what are the terms and conditions of service? According to the public service standing orders and the other rules that govern the service, these are also rules of who does what. They are rules which will determine the relationship between employer and employee. They constitute like an employment contract where the government will be reflected as an individual called the employer, and any public servant who will be applying for a job will be employee. But in that contract, both parties will have obligations to fulfill. While a public officer is appointed either on permanent or on pension or on contract, the following will have to be fulfilled. First, which is not highlighted here, every appointment in the service comes with an offer letter. And in that offer letter, in that offer letter, we always specify the post and code or the grade that you will earn, and we always issue that letter with an effective date of appointment. And then it will define the type of appointment amongst others. But the government, once has in terms of employer, once it has given you that employment contract, it will also come will fulfill its obligation to provide, for example, satisfactory, safe, and healthy working environment. Even as intern, you are entitled to a safe and healthy environment. Where you find this, the environment is not healthy or safe, you have to raise it with your supervisors or the institution where you are deployed. Then you have to get a reasonable pay, which is state, for example, now stated at 1 million. That has been determined as a reasonable pay. And then we have to ensure that in case you get employed in the service, we always get equal pay for equal work. If your work is on ward, you get the work of the who go to ward. If your work is like mine who go to office, then you get the pay accordingly. Then we always ensure protection of, for example, pregnant women and those people with disabilities. So in case you are among those, then you have to raise it with your supervisors and they will determine what type of protection you need as you continue with your internship. The obligation of a public officer continued. The public officer has to observe the official working days and working hours. And in this case, the DG area alone indicated and the ED Murago indicated what are the official hours and what are the official working days. Under health sector, we don't have official working days, we only have breaks. So you cannot say that it is a Sunday or Saturday, but your work is made in such a way that they are official breaking hours after maybe a certain number of days or having performed, I think, some hours. Then you have to perform your duties with a lot of dedication, diligence, and intelligence. And then you also have to be just in whatever you'll be doing. The rest you will have to read by yourself because of time. But you have to demonstrate high level of performance. The standard must remain as if you are a public officer already, because you will be working under those senior people and you are not expected to be involved in gainful undertaking outside official duties. The ministries and local governments should not communicate. You know, this presentation is about those who will be joining public service. But for interns, wherever you are not expected to communicate with outside the world except following the official command, which was communicated earlier when somebody said that you follow the chain of command. So you don't expect you to be the spokesperson of the institutions where you will be working, even if you are the one who has handled the case, except through your supervisor. That is an official spokesperson of the facility. And in case of Ministry of Health, it is only the permanent secretary. Then it is also important that correspondence is received, whether from public or bodies or firms and private individuals are acknowledged. So whatever you receive, you have to acknowledge the receipt. If you, for example, if you are issued with appointment as an intern, then you have to acknowledge the receipt. Later on, if it's an appointment letter, you acknowledge the receipt. If it's the correspondence which is official, then you acknowledge the receipt and then reply. Of course, the chief spokesperson of government is always the responsible officer. In this case, the permanent secretary. So let us look at what we should always remember: to do our best. You have to be aware of the work culture and also of your work schedules. We expect every intern or every public officer to add value to the service and to himself or herself. The dressing code, I cannot talk much about it. It has been emphasized during the presentation by ED Murago. especially those who have overcoats or uniform of any kind. It is mandatory that you are going to be, wherever you are going to be, you have to be identified by those dresses. But even besides that, because most of them, since they are overcoats, like for the doctors, the dressing inside or as you get out of the hospital must be commensurate with the office which you hold. We don't expect any indecency dressing in and around the hospital because you are intern. In conclusion, you are encouraged to know the provisions of the standing orders. I will give you the soft copy. For those who want to access, you can access it on the Ministry of Public Service website, which the organizers can give. And it is also important that public officers are aware of their rights and obligations. This is not a prison that when you have come, you just divorce the other rights you have as individuals. You come with your rights, you find the people with rights, you find the patient with rights, and every person around you will be enjoying his or her rights. So you are working with the Ministry of Health or as intern or later as an employee does not mean that you divorce your rights. Any issue regarding clarification and interpretation of the terms and conditions of your stay as intern, you can communicate through your responsible officer. In our case, it is always the permanent secretary, but wherever you will be, you will communicate through the accounting officer of the facility where you will be. Thank you. Professor, I think I'm time.
Yeah. Thank you very much, Mr. Warugahare, for that concise presentation. And thank you for sharing it with us. We shall share it with the people that are interested, and it's very enlightening. So thank you for coming. And also for the public service document, we'll try to get it to the interns leaders, and the interns can get it from he will distribute it. So thank you very much. And there are no questions as yet. If you can, please keep around. We'll have some time for questions at the end. And people are asking us to share your slides. We will share them with you later. Thank you very much. And now I would like to, okay, thank you. I would like to introduce Professor Sarah Chiguli. She's the principal of HEPI. So it's under the auspices of HEPI that we are doing this workshop this afternoon. She provides us with the funds. So thank you very much. She's a professor of pediatrics and child health and has mentored, I'm sure, very many of you. And she also supervises interns. And she's going to talk about managing your career and job market. As I said, this is just the beginning for you in the labor market. So there are going to be many opportunities, and would like her to summarize what those opportunities may look like. So Professor Chiguli, over to you. Thank you.
Okay, thank you. And good afternoon, everyone.
Sorry, just so Patrick, can you please stop sharing so that they can share Professor Chiguli's? Okay, good.
So good afternoon, everyone. I hope you'll be able to go through my presentation. So the topic, managing your career and the job market. I took it that for graduate training. The next slide. Next slide, please. So the outline
Sarah, are you
Forward
there?
and also opportunities and continuous professional development. Hello.
Yeah, you are breaking a bit, but now you are clearer. Please go ahead.
Yeah, I'm on the road. I left office where I had better internet. So please, next slide. I'll try my best. Okay. So I want the interns here, at least one person to share experiences. What do you love about your work and what support do you have? Can someone please share? Is there someone who wants to share what they love about being an intern and the support that they have? I did my internship about 100 years back, and there are some positive experiences that I learned. So do we have anyone who can share?
Please put up your hand quickly if you would like to share.
Okay. So probably we don't have people online. Yes, okay, Simon Peter.
Simon, please share.
Okay.
He has
So
muted.
I think let's move on. Let's move on. I guess that people here don't like internship. People don't love their work. People are learning a lot. But we want to also for you to look in the future. I can't forget my internship days. I started with pediatrics. That's where I am. And treating a young child and they recover and they go home, I think was a very happy experience for me. But still, I'm with you. I want one intern doctor. We may not do all of you to tell us 3 years. So please put up your hands. I hope you have voices. It could be an intern nurse, pharmacist. Yes, Timothy Lumu, where do you want to be in 10 years?
Yes, in 10 years, I hope to be a well-established medical professional, practicing the right medical stuff and earning a decent stipend for the good work I would have done.
Okay. Where do you see yourself in 3 years? If in 10 years you have a decent practitioner, what about 3 years?
I think 3 years I'll be in postgraduate school.
So he wants to be studying in 3 years. Do we have a graduate nurse? Didn't go through my class. And a graduate dentist, where do you see yourself in 10 years? Or pharmacist? Okay. Professor Chiguli, I'm not sure whether your people are following. Probably we should end this session because I don't want to talk to people who don't communicate back. It's really challenging. So can we go to the next slide, please? So in managing your career, you need to have a personal development plan. And we had Timothy sharing what his plan is in 10 years, in 3 years. You are following, but
Professor Chiguli, your network is not good, so we are not hearing you now. Okay. Professor Chiguli, are you still there?
Maybe she's driving.
I think she has dropped off. She's
Herself.
there, but I think the network is not good. She has dropped off. But I've been at this presentation. I can say that in managing your career, you really need mentors, and mentors were talked about by all the previous speakers. You'll identify mentors at different times in your profession, and they may be different. The one who mentored you through medical school may be different from the one who mentors you through postgraduate education, who mentors you at your place of work. And you need continuous professional development. You need to continue learning even when you qualify. You'll be, after internship, you'll be doing other things, but please never give up learning. A person who continues learning continues to develop. And for you to keep your brain active, make sure that you continue learning. And the need for networks, we talked about this at the beginning, that you need networks, not only amongst your doctors, your fellow doctors, fellow pharmacists, beyond that. Have people in your community, maybe you go to a church, maybe you attend Rotary, maybe something that keeps you in a community. Those communities support you, and you'll also be able to support them. And those collaborations are important. I remember the job I have now, I got it because I met Professor Maswa at the airport. And he said, "What are you doing?" And that was many years back. And then after many years, he remembered that we had talked and actually invited me to interview for the job I'm doing now. So it's important to have networks, and this helps us to be resilient. So having networks is an important part of managing our career as professionals. And also something else is there are many things that will come that will need you to make decisions. So for you to be able to make good decisions, you need to have people that you can consult, people that you talk to, because some decisions are difficult to make. And during internship, as you rotate through these different disciplines, you can decide which fits you best for postgraduate training. So in a summary, we need to really be conversant of what is going around us, what's going on around us, to be able to manage our career. And we know that internship is good, but it's not an end in itself. It's just part of becoming an established, successful health professional. So I will request that Sarah, I've given your presentation in your absence, but please summarize and then.
Okay, so
because okay.
We've not, in summary, there are opportunities. We shall share. I had more slides. People took more time, so now.
Yeah, so thank you very much. We'll share your slides
for time on development plan. Okay.
Okay. Thank you very much, Professor Chiguli. All right. So please bear with us. We said we would stop at 5, and we're going to endeavor to do that. Next, we'll have Professor Francis Omaswa, who is the founding director of ACHEST, and is really a passion for mentorship, and is going to tell us about global health systems, so that we know that it's not only our career does not stop in working here in Uganda. You can work all over the globe. So Professor Maswa, please.
Good afternoon, Chair Elsie and everyone else. I'm trying to share my slides. Can you see them?
Yes, please. Put them on slideshow, please.
Let me do that. I hope I can do
yes,
that.
please, we can see it very well.
Okay. Right. So now the message for this presentation is to remind our colleagues, the interns, that they are part of a global community, and they are therefore encouraged to think all the time of the global environment in which they practice medicine, nursing, pharmacy. And we start by sharing my experience of Africa. I was a big boy by the time of independence, and things were very, very hopeful indeed, very hopeful, not just here in Uganda, but in most of Africa. And then we had big trouble with poverty, coups, and that is not again just Uganda, but the whole of Africa. But things are looking better now. There is more stability, and the Africa is a better place now than it was like 15, 20 years ago. And this is where we are all living, and this is where you people are going to make your careers. This is continuing on the bad time in Africa. You can compare Ghana and Thailand, and then Nigeria and Indonesia. The other Asian countries made so much progress when African countries remained in a bad state. And this just shows that where we are now, Africa's disease burden is disproportionate to our numbers for maternal deaths, children under 5, and malaria and maternal health. So things are bad, very bad, and we should feel bad about this and work to put it right. And these are some of the reasons why we are where we are now. There are high levels of poverty, low economic growth. The populations are growing very fast, and we are not able to provide the services that we need because of huge populations in the schools, in the clinics, and so on. There is also a huge dependency. 50% of all Ugandan people are below the age of 15, and those are all dependents on the fewer people. And we have also been overrun by outside people giving us instructions on what to do, and the level of ownership for results is low. And then lastly, this is very important, you will be facing this where you work. If you don't give patients the right treatment, instead of taking you on and say, doctor, nurse, I don't like this, they just walk away. And they don't demand better quality of services, living normally with the unacceptable, the intolerable. Those are some of the challenges we face as Africans, but we value our health very much indeed. And when this study was done here in Uganda, in a poverty assessment study 2002, most Ugandans said that the biggest cause of their poverty was poor health and diseases, and the biggest impact of their poverty would be poor health. And they valued their health very much indeed. So that's where you are. Do you care? This is very important indeed. They were talking to you about being courteous. It starts about being caring. Caring about the condition of people whom you treat, who come to you for help. And that perhaps is the most important message that you can take from here. If you care about the people you serve, a lot of things will go right for you. Here is still another message about Africa lagging behind This is under 5 mortality. And the line at the top there is Africa, and so far away from the other continents. That's not good. So we as professionals, I would like to appeal to you to consider adopting the following roles. Being socially accountable to the people. You are there not just for yourself, but as a servant of the people. That attitude will take you very far. And work to ensure that whatever you can do well, do it as best as you can all the time. Doing the right thing the right way, at the right time, all the time. That is the definition of quality. And then ethical practice, you can't go wrong on that. And be supportive to your colleagues and hold each other accountable. Don't just think about yourself only. And this is the global environment in which the Ministry of Health, in red in the middle there, is situated. At the top, you have got global organizations. I will say something about them later. Then regional African organizations. You have then the boss of the Minister of Health, the President, Prime Minister, and so on, other ministries, and then parastatals. And in the oval there, we have institutions outside the ministry, but which have a role for health. That includes universities, of course, civil society organizations, advocacy, think tanks, etc., etc. And they are there in all the countries. We studied them in 5 countries. This is about Kenya and Uganda. The fact is that those organizations are there in all the countries. Now, let's look at the African regional structures which have a role in health. We start with the African Union. They have a health commission. And now, a few years ago, especially with the Ebola in West Africa, they have also created African Center for Disease Control, which supports countries. Then we have regional economic communities in Eastern Africa. There's what is called East Central and Southern African Health Community. Its office is in Arusha, Tanzania. Then there's the West African Health Organization, whose office is in Abuja, Nigeria, and the South African Development Corporation with its head office in Gaborone. These convene ministers of health annually, and they discuss relevant issues. Then we have the UN system here. WHO has got an office in Brazzaville for Sub-Saharan Africa and another one in Cairo for the Middle East. Just last week, the African WHO health ministers held their conference in Botswana. We also have regional professional associations. Like you have the Association of Surgeons of Africa, we have Public Health Association of Africa, and so on. And also professional colleges, College of Surgeons, College of Physicians, College of Nurses, and we have the African Forum for Research and Education in Health, of which our chairperson, Elsie, here, is the current president. So there are those transcontinental organizations. And then there are also civil society groups and think tanks, such as ACHEST and AMREF and so on. They are all there to drive the achievement of health goals of African people. The global structures are there. We have the UN General Assembly with the UN Secretary General. And next, this month, from the 21st, the UN General Assembly will discuss primary health care. And they do that on a regular basis. Then we have specialized UN agencies like UNICEF, WHO, UNDP, UNFPA, UNAIDS, and so on. And they all, in the end, have to find roles in the regions and in the countries. And many of these have got offices here in Uganda. Then there is what is called global health initiatives, which are created to address a special need For example, there is the Global Fund for AIDS, TB, and malaria, which is addressing those diseases. We have Gavi focusing on immunization, rollback malaria, stop TB, and so on and so on. There are very many of them, and it is quite a crowded field. There is also global professional associations, such as the World Medical Association, International Federation of Obstetricians and Gynecologists, FIGO, surgeons, cardiac people have theirs, and so on. You will aspire to join all those when you do the right things in your career. And there is the private sector, the pharmacy, the equipment manufacturers, and philanthropists like Bill and Melinda Gates. And there are also global CSOs, which are there to support a very complex global health system. And these are all there. You will, in good time, find that you can be a member, an active participant in all this, provided that you start your career properly, you are taking good care of yourself, you are focused, and you are performing well. The sky is the limit, quite literally. I think this is the last slide. It is called Global Health Diplomacy. This is how to make all those things happen. It is a very complex environment, but it starts with each country being clear about what they want to do. And then the international people come and find you in a good position to collaborate with them. And there are many levels, many actors, and it's a negotiation to manage global health policy. That is one definition. Another one is winning the hearts and minds of people in poor countries by exporting medical care, expertise, personnel, and so on. But in short, global health diplomacy is about how we here in Uganda can engage with the rest of the world to get the best care for the people of Uganda, get the resources that we need, and also make an impact there in those policies which are being made to run global health. And there are also trade. This is a big one also, a general agreement of trade on trade. There are what is called global public health goods, like the law on tobacco control, on infant feeding, on recruitment and deployment of personnel. There's a WHO code on the international recruitment of health workers. Don't just allow people to take you away. They should follow that code. In terms of global health security, global health security is about security from infectious diseases, and there are international health regulations to guide countries on this, and these are being revised at the moment. And there is also something called global health financing, which in the end tries to bring together resources to support countries, to support the global health workforce initiatives, to support that UN family system there, and all that is a very complex situation. At the end of the day, it is all about social justice, it's about equity, ensuring that every person in every village has access to good quality care without suffering financial embarrassment. That is the definition of universal health coverage. It is what you are going to be about, making sure that every person in every village has got access to good quality health care. That's the environment which you are joining. It's very exciting. And if you conduct yourself well, you will have a terrific time as a health professional globally. You will have friends here in Uganda, in other countries, anywhere in the world, who have already been selected by their own health systems, and the world becomes your home. I wish you all success with your careers in the health sector. It is a great sector. if I were to make a start again, if I were to go to S6 or S5, I would come back again to medical school. I've enjoyed myself in this profession. Thank you.
Thank you very much, Professor, for that enlightening presentation on global health systems. And it really shows that we don't work in a vacuum. And we really thank you for keeping in there and making sure that you keep encouraging the young professionals and mentoring them. Thank you very much. And if you have questions, please put them in the chat box. We still have some time. But now I would like to, I'm going to skip the video because of time. So we'll send the video to you to watch on quality assurance. But I would like to invite Professor Odoi Richard, a pharmacist who was my teacher, and he's still teaching. So he's really passionate about the work he does, to share with us on medicine use and patient safety. Professor Odoi, thank you so much for putting everything aside and agreeing to share with us on this important topic. Over to you, Professor. And may I ask the admin to share Professor Odoi's slides?
Thank you, Professor Elsie Shiguli. I think I wanted to do it myself because I can see the problem.
Okay, you can do it yourself. That's fine.
Yes. But as I do it, I want just to remind our interns or those going to internship that one of the very important things that healthcare needs is medicines. And this is because our population really believes that healthcare actually means availability of medicines. However, the medicines themselves are not really safe things. And someone, I want to go straight to a quotation from one of the scientists. Where it is? Oh, yes. Paracelsus, alchemist, a physician, in year 1493 to 1541, when he lived, that is over 400 years ago. He said, all substances are poisons. There's none that is not poisonous. The right dose differentiates a poison from remedy. I want all interns to remember that. And I know we've discussed this thing when you're in the university and now you're going to internship. But at that time, it was theoretical. Now we are going to live these things and to practice what we said about medication. So the medication, the presentation is medicine use and patient safety. The two things, medicines use and patient safety. And knowing what I've just read from that alchemist is very important to take home, that we're dealing with poisons and therefore should be careful while we are using them with patients. So in this presentation, we have to understand.
Prof, we don't see your slides.
Oh. Oh no. But, hey, sorry. Okay, can I get back to what you suggested before, someone to do it for me?
Admin, can you please share Professor Odoi's slides?
Admin, please.
Yeah, they are coming now. They are there now.
Are we on now? Yes, I was saying.
Yes.
Yeah, this presentation was really meant to I can't push it down. That's the problem of somebody doing it for me. Yeah.
Yeah, ask them to push them down for you.
Get back to the previous slide, please. Yeah. Oh. Now it's gone back to the real. first page. Can we get to next page, please? Yes, to engage healthcare providers, prescribers, pharmacists, and other healthcare professionals in evidence-based practices to avoid medication errors and enhance patient safety, and then to enable improved awareness and lead to changes in clinical practice measures, and to overcome common causes of medication. Next. Next. Next slide. Yes. We have to have the assumption that to make an error is a human. We accept that. And also accept that healthcare is a complex and inherently risky business. Then medication errors are multifactorial. Many factors make medication errors, and that focus should be on fixing the complex medication use systems in which we work. And finally, error prevention is proactive and involves planning and is an ongoing effort. Next slide. But also the care for the caregiver, the involvement in medical errors increases the burnout. That's what it causes. The likelihood of involvement in future errors, risk of depression was talked about by one of the providers this afternoon, the risk of suicide, and leaving the practice of medical care altogether. Next. I want to define this patient safety that we all know. Patient safety is the absence of preventable harm to a patient during the process of healthcare. And the discipline of patient safety is the coordinated effort to prevent harm to patients caused by the process of healthcare itself. It is generally agreed upon that the meaning of patient care is please do no harm. Next. Next slide. So what is the origin of patient safety concept? We take it from the Hippocratic Oath, which all share, some of you. Next. Next slide. But we look at the current environment. Errors and systems failures are repeated. Action on known risks is very slow. Detection systems in our detection systems of the errors are in their infancy. Many events are not reported. Understanding of causes are limited. Few examples of successful scale-up are there. There's limited measurement of impact, and blame culture is still alive and very well in our system. And defensiveness and secrecy is very, very much there still. Next slide. Medication area is any preventable event that may cause or lead to inappropriate medication use or patient harm, where medication is in the control of the healthcare professional, patient, or consumer. Such events may be related to professional practice, healthcare products, procedures, and systems, including prescribing, order communication, product labeling, packaging, and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. Next. Next slide. Yeah, this Paracelsus, alchemist, this is what I started with. At 400 years ago, this physician said, all substances are poisons. There's none that is not poison. The right dose differentiates a poison from a remedy. Now, this is a very important statement, important statements. Why? Because our community assumes the presence of the availability of medicines is a measure of healthcare. If patients go to hospitals or the health units and they don't find medicines, they think there has been no care to them. So it is very important that all of us who interface with medicines understand that they are poisons. Next slide. Next slide. Next slide. Yes. Now, the examples of medication incidents. The medication container from the pharmacy contains the wrong medication, or you take the same medication twice in the same way by accident. Next slide. Near miss or medication error. Medication error that took place but captured before reaching to the patient. Such events have also been termed as near miss. Now, what are the factors contributing to medication errors? One is human related, two is systems related, and then have medication related. Human, system, and medication itself, the process. Human related, the providers and then the patients. On my left hand, the providers either overworked, undertrained, lack competence, the low competence, distracted by many activities, is illness or ill, is stressed. On the patient side, on the right is the patients are in a hurry, and our communities do a lot of other activities. So they come to healthcare centers when the other activities are taking place. Then health literacy is level. Health literacy is level, is small. Do not understand the medication use. They trust providers not to make mistakes. So they trust a lot the providers. The system-related factors are lack of communication. Quite often, our healthcares do not communicate well to the patients. There's poor workflow, disorganized workspace, inadequate tools to complete work, and lack of supervision. Next. Then medication-related errors are like look-alike, sound-alike medication, sometimes termed as NADA, LASA. Second is multiple dose forms and strengths that cause a lot of confusion to health workers. Next.
Next. Edward, I think we are not seeing the presentation anymore, but continue, Prof. I don't know what.
No, I don't even have control over it, and I can't move now.
We are seeing it.
Okay, good.
We are seeing it. Let him continue.
But
okay,
it's not
thanks.
moving.
Sorry.
Next slide.
That's what it's seeing.
Just put the next slide.
Next slide. Oh no. He has gone away. Uh-oh.
He has run away indeed.
I thought Dr. Kerr said this, so that we are not seeing it, but please continue and finalize. Sorry,
no, I don't even see my screen now.
Oh.
I see
Peter, what is happening?
Just talk from the cuff.
Let me see if
I might have to do that. Now, let me return to my own slide, which you don't see, if that's okay.
There are some slides being shown now.
Yes.
Yeah, next.
Next, okay. Yeah. Then we have, yes, we have the 6 R's, which are very important as a health worker and even the patient. The right drug, the right route, at the right time, the right dose, the right patient, and the right dosage form. All these things matter. If we get right drug to the wrong patient, it matters a lot. Next. Now, what are the types of medication errors? They include prescribing error, dispensing error, documentation, administration error, transcription error, and indent error. Next, let's look at the prescribing error. Example is, it is a clinically meaningful prescribing error occurs when, as a result of prescribing decision or prescription writing process, there is an unintentional significant reduction in the probability of treatment being timely and effective, or two, increase in the risk of harm when compared with generally accepted practice. And this includes incorrect prescription, illegible handwriting, drug allergy not identified, irrational combinations, or out of list abbreviations. In the next, yes, you're not seeing it. Oh,
I'm
We are
seeing
seeing
it. We are
it.
seeing it. Continue.
yes.
Continue.
Are you seeing the poor prescription? That can
Yes,
be
we are seeing it.
Can you read that? Can anyone read that? And I see that a lot of that in when I used to practice pharmacy.
I can't read it.
I can't make sense of it, and I'm supposed to make a sense of it in order to give out medication. Next. Oh.
Yes.
Guys, I have a lot of difficulty here. Yes.
You continue, yes.
Always use leading zeros for decimal points. The order should have read the digoxin 0.5. And as health workers, we all know the problem of the digoxin. Now see how it was written. And that can cause big error.
Uh-huh.
Yes, I want to go to the next slide, but I can't.
Yeah, you're on now.
Huh?
It is on.
Yes.
Dispensing error.
Dispensing error. Dispensing error is a discrepancy between prescription and the medicine that the pharmacy delivers to the patient or distributes to the world on the basis of this prescription, including the dispensing of medicine with inferior pharmaceutical or informational quality. Next.
Yes, it's on.
Now the numbers. And 98.3 accuracy in dispensing medication is required. Therefore, only 1.7 inaccuracy can be accepted. Over 3 million medication dispensing per year, or four errors per day, per 250 prescriptions filled, over 51 million dispensing errors per year. Next, that is research that was done. Now, what are the most prevalent dispensing errors? Now, dispensing incorrect medication, giving the wrong dose strength or the dosage form. Second is dosage miscalculations. And third is failure to identify drug interactions or contraindications. Next. Next. No. Yeah, this is what I said, Lancer, sound alike, and look alike drug names, which can cause a lot of problems. Example is clonidine, third name catapres, clomipramine, codeine, etololac, and clotrimazole, These look alike, the drugs that look alike, and the names very similar, almost similar, and cause a lot of errors. Next. Then we have the errors of omission. Failure to counsel the patient, and failure to screen for interactions and contraindications. Next. still errors on commission, miscalculation of a dose, and dispensing the incorrect medication, dosage strength or dosage form. Next. Common causes of dispensing errors: the work environment, the workload, the distractions, work area, use of outdated or incorrect references, and look alike, lots of drugs look alike, sound alike, and let's continue. Next. Example of dispensing error. A physician writes an order for primidone for a 12-year-old boy with a seizure disorder. Misreading the physician's handwriting, the pharmacist mistakenly fills the order with prednisolone. For 4 months, the boy receives prednisolone along with his seizure medications, causing steroid-induced diabetes. The diabetes goes unrecognized and he dies from diabetic ketoacidosis because the drug was LASA, look-alike or sound-alike names, drug that leads to dispensing error. Next. We're back to this prescription and the handwriting of physician, which is a poor communication. Like this sounds like Vin Christine, but I'm only thinking it has been Christine 1.4 milligrams per square. You know, you can't tell. That leads to an error. Next. Now there's this ambiguity of writing orders. Again, there's some digoxin here. I can't tell the first one. And then the down one here, which bolded, dilantin, Tagretol, I don't know what it is. You can't rely on this. That's an example, another example. Next. The error due to administration. For instance, a drug administration error may be defined as a discrepancy between the drug therapy received by the patient and the drug therapy intended by the prescriber. The administration errors account for 26% to 32% of total medication errors. That's research done. And it involves wrong patient, wrong route of administration, wrong drug, wrong dose, wrong method, and wrong time. Next. So what are the causes of administration errors? Lack of perceived risk, lack of availability of technology for counting, lack of knowledge of the preparation or administration procedures, complex design of the equipment, and other contributing factors to drug administration errors are failure to check the patient's identity prior to administration of the medication, the environment factors such as noise, interruptions, poor lighting, wrong calculation to determine the correct dose. These are all things that someone should prepare. Next. Another example is the critical care nurse tries to catch up with her morning medications after her patient's condition changes and requires several procedures. He is intubated, so she decides to crush the pills and instill them into his nasogastric tube. In her haste to give the already late medications, she fails to notice the do not crush warning on the electronic medication administration record. Do not crush, and yet goes ahead to crush. She crushes the tablet calcium channel blocker and gives through the NG tube. An hour later, the patient's heart rate slows to assistant, and he dies because of administration error. As example. Next. Next. What about transcription
It's
error?
on. It's on, yeah.
I can see it. Transcription is a process of making an identical copy of prescription in the medical records. Error that can occur in this process is known as transcription. Several sheets of paper and stages from physician's order to drug delivery may cause confusion and add to the possibility of transcription errors. Contributing factors include incomplete or ineligible prescribed orders, incomplete or illegible nurse handwriting, use of abbreviations was another factor, and lack of familiarity with drug names. In addition to errors associated with transcribing, there is also opportunity for errors when transcribing the dose, route, oral frequency. Next. Next.
Solutions.
I want to suggest some solution. Next is training, one of them. Next, capturing errors and analyzing them. It's important to capture the errors, to be available to capture those errors. One is voluntary reporting programs. I think ND has tried of recent times in Uganda. Information from technology, infusion pumps, barcoding, electronic prescribing, and pharmacy systems. Focused reporting triggers, specific medications, surveillance systems we don't have. Most important is using internal and external information. Next. How do you safeguard for name mix-ups? Provide indications on prescriptions. That's one. Communicate with prescriber if unsure. Cancel the patients on all new prescriptions. Then new AI software becoming available that will tag medications to disease states. Set up electronic systems for prescribing and pharmacy. Dispensing cabinets in hospital, clinics, long-term care to require 4 to 5 characters. Visually differentiate look-alike drug names. Use of tall man letters with bolding, highlighting in the pharmacy computer system. Cancel patients on all new prescriptions. How can we do this? Next. Next.
It's on.
Yes, addressing wrong patient errors. Use of at least 2 patient identifiers. Hard stops in systems that must be verified. Patient armbands for barcoding whenever feasible. And mandatory patient counseling at the pharmacy. Next. Next. I think one would focus on system errors like the tasks, procedures, workflows, workarounds. It's very important. Procedures, workflows, and workarounds will be taken care of. Then organization, the policies that should be in place, the culture and commitment. Then go technology, with medical devices and other applications. Then avoid interruptions, noise, and distraction. Is that possible to do in the workplaces? Next, from the last. So what are the human factors approach to own errors? First of all, Do not blame individuals for the mistakes they make. Do not ignore work system factors and hoping for the best. Do identify system factors that contribute to errors, and do not blame leaders for poor work culture. Next, which is the last, thanking you for adding. Thank you.
Thank you, Professor Doi, for that is a very important topic, and we'll share those slides with you. Please give us about 20 more minutes to go through all the presentations, and we will finish. And next, I would like to call upon Ms. Adong Janet, the President of the Federation of Uganda Nurses and Midwives, to summarize her talk in 10 minutes. Please, Janet, sorry we have to cut your time short, but we really know that this is very important. Please go ahead and share your presentation.
Thank you very much. Could the admin share it for me? I'm already in darkness, almost where I am. Thank you so much for this opportunity. I know we have almost lost half of the number, but this is going to be very short because most of the ideas have already been said. That is my name, and I am the president, as said, for the Federation. Next slide, please. Next slide. Next slide, please. I think it's important that we know the goal of the Federation. I thought we should just say something about the Federation. The Federation is to promote, the main goal is to promote the nursing and the midwifery profession in Uganda in order to cultivate the nursing and midwifery services in Uganda. We all know that after qualifying and after registering, we are now entering the world outside there. So it is important that you belong somewhere and belong in the association. The Federation for Uganda Nurses and Midwives is a registered body. After recognizing that there exist several associations within the nursing and the midwifery, like you also see with the doctors. But it's important that we have one inclusive association that acts as the father or the mother or the body for all the nurses and midwives. And therefore, the Federation is one of those pillars. We have the 4 pillars in nursing. We have the association, we have the education, we have the regulation, and we have the practice. So the Federation is, the association is actually one of those pillars that govern our practice. Next, please. These are the principles of the association. Majorly to promote and preserve nursing and midwifery association, particularly to have professional belonging. You cannot be out there and you don't belong anywhere. You need to belong somewhere, and the Federation is where you're going to belong because it is the association for all the nurses and midwives, inclusive of all the other different associations. We also want to uphold and deliver safe and quality healthcare, promote accountability for the actions of nurses, and then protection, promotion, and preservation of the healthcare of humanity. The association stands to respect for social justice, equity, and dignity of all the people, above all transparency and integrity. And in particularly, we want popular participation and tolerance of views of nurses so that we are there to listen to one another. We want recognition and respect for the various roles of professions and the stakeholders involved in the promotion and attainment of the healthcare, the highest standard of health. Next slide. Now, when we come to talk about the nursing competencies, I know that these ones have been shared by the previous speakers, but particularly for the nursing, we know that nursing and the midwifery competencies are based on core principles, ethical values that I know that they have taken you through. But it's important that we keep echoing this for you so that you keep at the back of your mind that you're not going to work with animals, but you're working with human beings. Therefore, it is important that you keep the principles, you keep the ethical values, the standards of conduct, and these values, principles, and standards are of importance when you are working out there in the world. Next slide. So what are these principles that we are talking about? I know that sometimes we keep reminding ourselves, these are actually in the scope of practice, which you are going to get when you get out into the world to work. We need to know that nursing is an autonomous, self-regulating profession whose interventions are based on scientific principles. So it is actually an act and science and aims in professional excellence in providing compassionate, holistic, comprehensive, culturally and socially sensitive to the clients that we serve. Next slide. How do we respond to the actual emerging and potential health demands? Throughout the development stages of healthcare, stages of clients' lifestyle and along the continuum of care, it is important to identify and respond to the special needs of the vulnerable groups in the community. Those are the children and those that list there. You know that we are the people, we are the backbone of the healthcare services as nurses and midwives. And your care is paramount and very important that you respond to the needs of the clients. Next slide. What is our practice like? Nursing and midwifery practice is based on science of assessment. It is important that you assess a client before you plan to implement and evaluate the services that you are going to give these clients. And of course, this should be based on research to give you an essential component of care that you can provide to these clients for the better outcomes. So practice embraces compassion, responsibility, empathy, accountability, leadership that was mentioned, and policy formulation. As a nurse at your level, you need to embrace all these qualities of a nurse during your practice. Next slide. We have interventions for the care. What drives our interventions? Of course, we have this promotive, curative, preventive, and rehabilitative, as well as palliative care interventions within the context of public health. But all this is aimed to promote healthy lifestyle, assess clients to participate in their role, and modify the impact of diseases. As a nurse, you need to really have all this at the back of your mind. We're not, I keep saying we're not dealing with machines, we are dealing with human beings. So we need to be cognizant of what do they need. Do they need palliative care? Do they need older care? And the other thing is the functionality of the nursing and midwifery. As a member, nursing and midwifery is a member of the healthcare team. That is why we are all together in this meeting. And our role is to promote the dignity and collaborate with the other stakeholders to ensure that our clients are actually receiving the best care that we need. So we use innovative strategies for safe and supportive working environment and facilitate provision of quality of care in various settings. So you just don't wake up and be a nurse. You need to be innovative each time you're dealing with the clients because they come in with lots of complaints and we need to be aware of all the surroundings that we are dealing with. This is in summary, the competencies of the nursing. This has been mentioned by several people that our values and standards of conduct are based specifically putting the care safety of the client in the middle. So we need to be collaborative. We need to respect the dignity of the client. We need to have professional responsibility and accountability, respect and practice, quality of practice while we are giving care. And then we, above all, and some of the previous presenters say, trust and confidentiality. Clients will trust you. And if you're confident, if you are keeping confidentiality of their information, it's not supposed to be discussed across the road, in the taxis, and in your homes with your partners. Next. So this is just for you as you come out from, as you go for registration, that you need to belong to this association, which is already registered, and you can, the details, this slides that is going to be shared, this is just the details of how you can register and belong to the association. We are collaborating with many other partners. HEPI-SHSSU is one of them, and Professor Maswa is actually one of the patrons that support us a lot. I work in JAPIGO, and JAPIGO is one of the partners and support for the nurses, SEED Global, and all the other partner associations across the country. So you need to find a belonging as a nurse, and that is the ask of you, that as you come out, affiliate to one of affiliate to the association, so that we are affiliated to the ICN, the ICM, and become a member, so that you can benefit. The registration is that only 50,000 paid once, annual subscription is 50, and we hold regular elections. We are the newly elected members. Next slide. Next slide, please. And that is the membership. We have individual members. As soon as you are registered with Nurses Council, you also register with the association. You can become an associate member, and you can also become a honorary member. Next slide. I think this is almost the second last slide. Work in progress. We are very soon distributing the cards for the members, and working on strategic directions. Next slide, please. What is our plan for the scale up? We are now scaling to regional committee members, to those different regions, as well as the districts. One thing you have to note that the federation, the association had been on a hold, and the union was taking care of the association activities, and we are just reviving. That is why we seem to be new, but it is important that you come on board and we drive this together. This has been a lot past. I hope the slides are going to be shared so that you are able to read more. But my contact, you can still get in touch with me. Those are the new executives, Janet being the president, plus all those persons down there in different locations across the country. So thank you so much for the listening. And I know that time is not with us, but this slide is going to be shared. And for information, please get in touch. I know my number can be shared. Thank you so much for this opportunity. May you have a
Thank you very much, Ms. Adong, for that presentation. It's valuable, and you are right. We work as a team, and it's very important during internship for us to actually enhance that teamwork and make sure that as health professionals, we all know our roles, but at the same time, we work together to ensure that we get good patient outcomes. So we really appreciate your presentation. Thank you so much. And we have, last but not least, Dr. Dr. Kolo, who is the Executive Director of ACHEST, and has really ensured that this takes place. He's going to talk to us about compassion for health professionals. It's going to be short, but it's very informative. Please keep in there until we finish. Over to you, Dr. Kelo. Please share his slides. Good. Dr. Kelo.
Very good. Thank you very much, Professor Elsie. You have done us proud, but we've lost almost half of the team we started with. We were about 150, now we are just about 79. This presentation will be shared. I'm going to talk about compassion. And this is not a subject that may be new to you. In most cases, health workers are taught to give compassion to their patients, to their clients. But we rarely emphasize the need of compassion for colleagues, compassion for fellow healthcare workers. So I'm going to talk about caring for the caregivers. This is what Professor Richard Odoi talked about. We need to care for the caregivers. And what is compassion? Just a rundown to some definition. It encompasses the recognition of the suffering of others and then take action to help them. Compassion embodies a tangible expression of humanity, of love for those who are suffering. It also encompasses a desire to alleviate the distress of others. It's the knowledge that there can never really be any peace and joy for me until there is peace and joy finally for you too as a colleague. However, in our practice, we realize that the employer may not always relate to these matters enough. And we need to address how does this relate to employee performance and the well-being of the health workers generally. The background to this is very simple. Healthcare workers carry heavy burden of duty at their duty places, especially during health crises like during COVID-19 outbreaks and during Ebola crisis. The duty that is exerted on healthcare workers is enormous. And it's important, therefore, that we support their psychological well-being as a priority as employers. We should be able to identify risk factors for adverse mental health outcomes among them during outbreaks like Ebola and COVID-19. Dr. Onyero talked about stress in the place of work, a very elaborate presentation, but really these things get out of control when you have crises like Ebola and COVID-19. Next slide. There is a triad on compassion. The compassion equation encompasses three things. First, awareness, being aware that there is a problem, that colleagues are in trouble, talking about it, and showing that you really care about their situation. And it takes courage and self-awareness to realize colleagues are going through a bad day. We usually don't do this. So that awareness is an important part of the equation. And then showing empathy, taking interest, and reaching out to console colleagues who are in trouble. And it's not just enough to be aware or to show empathy, you also need to take action. So these three things, awareness, empathy, and action, to do something about it, is what compassion is about. To give them time to rest, as you were told earlier, is an action. Year 2021 was a year of health and care workers. I want to refer to it. WHO designated this as a year, International Year of Healthcare Workers. And we must explore ways of how healthcare workers can be more intentional about self-compassion. Lack of understanding of how we handle colleagues who are working under very stressful conditions can have major consequences on their psychological well-being and even their performance. And really, this year, which started in 2021, continues letting us, pushing us to care about our colleagues. And that's a problem we need to talk about today as well. Next slide, please. Field experiences here in Uganda and other places, we have found that frontline health staff have serious concerns. During COVID-19 and Ebola, healthcare workers faced many additional sources of stress: long shifts, movement restrictions, personal isolation, fear of infection, inadequate PPE, somebody talked about it, and even having direct contact with patients. And they were worried about getting sick themselves. There are concerns about carrying infections to your family. There was heavy workload with emotional strain, physical exhaustion, and outright burnout. Sometimes there was stigma. People were avoiding you because you had worked in a COVID ward, and then you are working overtime and no time to rest. This is a common story with health workers, and you new interns, you will find that you are always working under pressure. And I need to point out this. This has been mentioned earlier, but I'm just bringing them as experiences we should know about. Next slide, please. And there are risk factors for our psychological well-being. There are other risk factors, limited supplies. I talked about PPE, not enough. You are always working under pressure. This is not good for your psychological well-being. And limited support from management. Sometimes management does not listen to us enough. That's why the intern who just finished said they had to go on strike and so on. This is not good. Next. I want to share with you a lesson from the UK. You may have heard about this, but let me just share with you. People across the country took part in a mass applause for nurses and other frontline workers working in the national health system. They praised their working style. They praised them during the COVID outbreak. In fact, there were days they were calling them Clap for Our Carers, an initiative that was raised by residents, applauding them when they come back from work. Everybody stops, the cars stop, and they start clapping.
We can no longer hear you.
Really? There's a lot of rain here, but clapping for carers is important. It's a simple act of appreciation. They go a long way to boost the morale of the healthcare workers. That happened in the UK during the COVID outbreak, and I think it can be done anywhere else in the world. Next. What can be done? This is essential about health workforce management. I think this is an area that is generally neglected, and the DG talked about it. I think we can do more. Employers should love the people they lead and win their trust and feel for each other and share their pains. I think we can show more that we care about our workers. We need to ensure sufficient rest, time off, provision basic tools for our healthcare workers. We need to build leadership capacity and awareness among supervisors and leaders at all levels on the issue of compassion. Sometimes there is too much demand about we should work, you should report on time, and people don't check how you are coping. And really, we need to do more, even building the capacity of your supervisor. We need to raise even population and community awareness to issues faced by healthcare workers. Sometimes it's the people we serve who are least sensitive about our conditions, and they don't see that we are traumatized, that we've been working for 24 hours without eating. I think we need to train people and create awareness about the plight of health workers. Health workers, you care for your patients, you look after your patients, but sometimes we don't give enough attention to ourselves, to colleagues. I'm appealing to all of us, look after yourselves, look after your colleague. When they're going through bad time, it's you who can help them. I don't want to proceed beyond this. There is a lot of rain and many people are already running away, but caring for each other is part of our responsibility. Over to you.
Thank you very much, Dr. Okello. That is a very important topic, and this presentation, we shall pass it on to as many site leaders as possible, because it's important for them as well. I would like to thank you all very much for being here. For our speakers, especially those who have gone on up to the end, thank you very much for your presentations. And also to the interns, thank you so much for being here and for listening in. And please look at the evaluation link and evaluate the program and see how we can make it better. And also look at the handbook. We posted the link. I would like to ask Dr. Okello to give us the last word, and then we close. Dr. Okello, over to you.
Thank you very much, Elsie. I think the experience today, the presentations were great right from the beginning. I really liked what the DG said. The DG said some of the things that maybe you people don't hear a lot, but he said a lot of good things, and we should be encouraged. Many issues were brought up, but this is a process that is ongoing. Internship is just one process of your learning. Please pay attention to your supervisors. The world is expecting a lot from us, and I think we can do more. But 1 year is not a long time. Within a year, you will be a fully fledged doctor, and then you start looking after yourselves. So I'm wishing you well. Good luck with your profession in all the disciplines. Medical doctors, nurses, pharmacists. The world is waiting for you. Just stick there. There may be some suffering here and there, but you're about to clear it. And good luck with your own lives. Thank you very much. I will now bring this exercise to a close and thank all of you, the presenters, the interns, for the attention. We've gone beyond our time we had scheduled, but I think some of the presentations were so good, so Elsie allowed them to continue to the end. But well done to everybody. Thank you, Elsie.
Thank you very much, Dr. Okello, and thank you, everybody. Thank you, our support staff, IT, and have a nice evening. Thank you, all of you. Enjoy your evening. Bye.
Thank you so much for the presentation. Have a nice time.
My friend Richard Odoi, how are you?
Thank you,
Thank you, Dr. Okello.
I have not seen you for a long time. We need to meet and talk.
Bye, everyone. We are closing now.
Yeah.